morning, everyone, and welcome to the second day of our research workshop on school violence prevention and response. It's really great to see you all here and very excited about the agenda today. We have two very good sessions. In the first session, we are going to explore topics that currently have been understudied in the literature, taking a look into the prevalence of violence and disabilities, also into the connection between drugs and violence, among other topics. So I'm very excited to welcome our moderator for today's first session, Gemma Wilson-Clark, head of the Safe to Learn Secretariat at UNICEF. Welcome, Gemma.
Good morning, everyone. I hope you've all had your coffee and you're ready for a second stimulating day of learning and discussion. As Gabriella introduced, my name's Gemma, and I lead the Safe to Learn coalition and initiative based in UNICEF, which brings together 19 global partners all working to end violence in and around schools. And we have at least 2 of the member organizations with us today, and CGD, of course, who is a sister organization. And I just wanted to take a moment to tell you a little bit about Safe to Learn before we start. To date, 19 countries have endorsed the Safe to Learn call to action, and we're working as a coalition to connect governments with the resources, evidence, and organizations they need to embed child protection in education systems. So you can see the QR code on the screen, and I'd encourage you to have a look at the tools and resources of the partner organizations that are available all in one place. I hope that you will find that useful. Advert over, I'll get on with the session. So I'm really pleased today to moderate a session on the diverse challenges of addressing violence in and around schools. The evidence we'll hear today demonstrates how school violence is shaped by place, by gender, by identity, by norms, by social and economic pressures, and by the everyday realities that children face in and around schools. And we heard, I think, some of that coming through in the conversations yesterday, particularly the session on social and behaviour change. The researchers will be presenting evidence on what I think are really important unexplored dimensions of the challenge. And so let me briefly introduce them. We only have one of our speakers here today due to visa challenges, so we'll have to really try and keep the energy up in the room and send our support to our presenters from afar. I'm glad it's the first session. So first of all, we'll be hearing from Sierra Leone, where Stephen Kandana of Sightsavers will be highlighting how children with disabilities' experience of school-related violence is shaped by social norms, traditional beliefs, and geographic location. Then we'll hear in person from Slungele Twala of the University of Eswatini, talking about how poverty and students' involvement in illicit income-generating activities can fuel cycles of school-based violence. From Cameroon, Rice Herman Putong of the University of Dashang looks at the risk factors driving violence against educators and school staff, certainly something that we didn't really focus on yesterday, so I'll be very interested to hear how those two are connecting in the research. And finally, from London School of Hygiene and Tropical Medicine, Emily Eldred will discuss how her systematic review really shows major gaps in how violence prevention interventions address equity across different groups of children. So that's our menu for today. Get your questions ready, and let's begin by hearing from Stephen from Sightsavers, who's reaching out to us from Sierra Leone. So Stephen, are you on the line? Please go ahead.
Yes, I am here. Thank you very much. Thank you very much. And nice talking to you all in Washington. Michael, my slide, please. Okay, in that case, let me share my slide if Michael has not got any. Yep. Can you see my slide? Hello?
You can hear me because I'm mic'd up, but yes, we can hear your slide. Hear your slide and even
Oh,
see your
thank you.
slide. Yeah.
Yes, thank you very much. Today I will be speaking to you about understanding school-related gender-based violence. We conducted this study from the perspective of children with disabilities in Sierra Leone. Gender-based violence is quite widespread in Sierra Leone and is deeply rooted in tradition, social and economic gender inequalities, with 62% of women experiencing physical and sexual violence all around the country. A recent study in Sierra Leone also identified corporal punishment, sexual threats and violence by teachers, and bullying and sexual harassment by peers, as various forms of violence in Sierra Leone. And this is quite prevalent and it is also growing. It's a concern for us. Children with disabilities, of course, are more vulnerable to abuse. I think that is something that has really been established. In all this prevalence of school violence, the government of Sierra Leone is making progressive effort to address it. But of course, implementation is quite weak and fragmented because the various stakeholders involved are really not coordinating their activities. And there is also, the lack of reliable data. So from that background, we decided to conduct this study to understand and articulate the experiences, perception, and needs and concerns of children with disabilities regarding violence in school. We must know that all through, there has been quite a lot of research on violence in schools. There has been quite a lot of work also with children with disabilities, but most of the time, people tend to express their own perceptions rather than the perceptions of children with disability. So this research was conducted in Northwest and Sierra Leone in a very remote district known as Carine. And we were able to conduct this research in 4 schools in 3 communities, Kamakwe, Makulon, and Rokulan. Kamakwe is a bit a semi-urban location, but the other 2 locations are quite remote. And when we share the findings of this research with community members, they use it to develop location-specific SRGB plans. And I must let you know in this page that this research was funded by SVRI. Our study was grounded in community-based participatory action methodology, where we put children with disability at the center of the study, focusing quite a lot on them. And we use 4 interconnected data collection methods, mainly focus group discussion, where we engage children in discussion to know their perspectives about school violence in school, where it happens, how it affects them, and how they think they can be better protected from it. We also use participatory mapping, where children gathered a large pre-printed map so that they will tell us their residence, where they live, and how they travel to school. And along that route, they showed us felt safer. We also use photo voice, wherein our young researchers walked around the community taking photographs of areas, especially the GPS and narratives of what children told them that provided information on the hotspots of violence. And of course, we presented all that findings to the community after like 6 months, and they were able to use that information in their participatory action workshops to develop response mechanisms. We recruited 8 youths. These are young graduates from senior secondary school, from 8 communities, that is two per school. We recruited them as community researchers so that they can lead on data collection. The reason was we wanted to make the children very comfortable, and they all already know these young researchers. They have grown up with them, so it was easy for them to talk to them, to get information from them. We audio recorded every discussion, and transcripts from those audio recordings were analyzed thematically. And then for the geographic information, we annotated maps, notes from participatory mapping activities, and geographic information from PhotoVoice. These were analyzed by a GIS software, ArcGIS Pro. Now, what you can see here is an example of two maps. On the left-hand side, we have the map that was plotted by children. The blue stickers you see there are the places where the children live. And you can see that they have plotted their route from their residences right down to the school. And along that route, they have shown us spaces that were safe, represented by the green stickers, and areas that they felt were not very safe, represented by the orange or red stickers. And of course, this information was processed through that software, and we ended up with that digitalized map, which the children liked very much, which we also shared with the government extensively, so that they will know the geography of school-related gender-based violence. Now, in terms of our findings, these are our young researchers, people living with disability who helped us to collect that data. Now, in terms of participant characteristics, we collected data from 70 children. Nearly 50% of them were girls from all schools, and children had the following impairments: speech, sight, hearing, and mobility difficulties, and they were all within the ages of 12 to 15 in 7 to 9 years of education in Sierra Leone. Some children who participated in data collection actually moved out of the study area when we came back to present that data to them. So most of them were not there. We also collected information from community members. These are mainly parents, carers of children with disabilities, and people who interact often with children with disability. But then, because it was a community meeting, only 20% of representatives were women. Now, when we analyzed all this data, we discovered that children experience violence in 3 main areas: physical, sexual, and psychological. Now, children who experience physical violence associated that issue with unequal relationship between them and other people who were stronger than them. And so if you look at this quote that we got from one of the children in a school, he was of the view that he said this: if stronger boys meet you on the road and you are walking slowly, they will just push you out of the way instead of helping you or even saying, "Excuse me." And we discovered that corporal punishment was widespread in all the schools. But boys were more affected than girls. The simple reason is that teachers felt that the boys were more argumentative. You know, they challenged them in class, they challenged them in school. So they faced quite a lot of punishment. Children, of course, with disabilities were aware that disability stigma was responsible and contributes to most of the violence that they experience. In terms of sexual violence, girls with disabilities identify sexual violence as a key SRGB challenge for them. And this was perpetrated by peers, teachers, and other community members. Inappropriate touching, which they refer to commonly as bad touch, was identified as the most common form of sexual violence they experienced. This quote is from one of the girls. Boys make sexual comments and touch our body parts, but when we report to teachers, They just tell the boys off and warn us not to go close to them. So it is a clear demonstration that reports about sexual violence were really not addressed in the school at all. We also discovered that girls suffer another form of gender-based violence from a traditional angle. During the rite of initiation or the rite of passage, girls were made to undergo FGM, female genital mutilation, which is prevalent in the area. And of course, children with disability and those who are really younger were forcefully initiated into this. Now, initiation takes like 3 to 4 months. So that means girls miss a lot of class time during FGM. But we also discover that FGM is not only an abuse, but it has a lot of implication on girls. In terms of psychological violence, we discover that taunting by peers at school, which mainly happened in the school and on the way to school, was widespread in all the schools. And it involves calling children with disability by derogatory names that are not acceptable by all at all, and making fun of them, especially of their impairments. We found out that taunting was a major cause for missing class, a major cause for poor academic performance, and in extreme cases, it has led to drop out of school. This is a quote from one of our respondents. I am constantly taunted by my colleagues in and out of school. Every day I have to leave school before closing time to avoid being tormented. And at the end, you can see that each time this young boy thinks about this, he just wants to stay at home and not go to school at all. And we came across this kind of accounts almost in every school from a number of children. Community members informed us that taunting affects girls more than boys with disabilities. And this is a quote from community members. Boys with disabilities can withstand taunting better than girls. For the girl, once people say unkind things about their disability or about them, they just cry or fight back. And we had instances and stories from community members where children with disabilities have actually attacked those who taunted them with sticks and stones. So each time that happens, of course, at the end of the day, it is the girl with disability that end up being injured and exposed to all sorts of risk. Now, we also discover that there are challenges reporting SRGBV. Complaint mechanisms were weak, and in some cases, they don't exist at all. And even where they exist, they are not applied. We discover that leaders, including school management teams, do not hold perpetrators together, do not hold perpetrators accountable for their actions. Now, as I said before, Karina is quite a remote district. And so police and court services are very limited. So it becomes quite a challenge for children to actually report or for their parents to get justice for any harm done to them in school or on the way to and from school. In fact, in one school, we discovered that the school management team actually attempted to protect teachers rather than the victims or addressing this SRGBV. Now, this is a quote from one of the SMT members saying that the school does act on reports of SRGBV, but these are sensitive issues. If you cause a teacher to be disgraced, then the others will rise up against you. Again, geography plays a lot of role in this. The schools are remote. It is difficult to get good teachers, especially in the areas of the STEM subjects. So, because they literally bribe these teachers to stay in school and teach their children, we discover that these teachers were mostly at liberty to do what they want to do. And if you can see the photograph of the left-hand side, there are all these laws about bad touch. Report to your trusted adult, report to a mentor, or the guidance and counseling teachers, don't keep quiet, call those numbers. Now, those numbers are numbers provided by the Ministry of Education. During the process of collecting data, we tried all those numbers. None of them went through. So children are really at the mercy of people who abuse them in that area. Now, just to show you a few photographs, we learned from children that, they feel very safe near facilities where there are a lot of adults. They also feel safe on roads, with limited traffic and where other adults are traveling along with them so that they are not alone. This other photograph shows the Central Park in Kamakwie. Children with disabilities going to school are quite afraid to come to this area because it is quite busy. There is a lot of traffic. You can see the motorbike at the end in that photo. They move at great speed, so they are completely afraid to use this area. And in this other picture on the right-hand side, you can see this rugged path going to school. Children with disabilities, of course, are completely afraid to use this route because it exposes them to quite a lot of accidents. Now, I told you before that we involve community members in this research. We collected data from them. And when we came back after data collection, we presented our findings to them. And they got into a quick meeting and they decided to develop, location-specific SRGB response actions. And from across those communities, these are some of the things that came out of their meetings: to raise awareness, on disability issues, raise awareness also on violence in school. They want all the bylaws on child protection to be revised and made effective so that they will begin to work again. And of course, they suggested that people to be involved in this kind of revision are the chiefs, the ministries, NGOs working in that area, and the children themselves. They also want to improve the complaint mechanism, which is completely lacking. Nobody is responding to what happens to children. And then communities suggested that they need to improve the road condition that children use to and from school. And one or two communities suggested that, in fact, children with disabilities should be accompanied to school whenever they leave their houses. And there is this issue about the tradition, about the right of initiation, and communities are saying that they really need to protect girls from FGM so that it does not interfere with their school, so that it respects their rights and also preserve their health. Now, as I conclude, I just want to leave you with three key messages. Our study highlights the importance of providing children with disabilities the opportunity to share their experiences, views, and concerns in an ethical and safe mode setting, including, of course, digital methods such as photography and participatory GIS was quite good because children saw that as a way to share their experiences. Children with disabilities encounter multiple forms of sRGBV. So interventions must pay attention to these experiences and needs of all the children with disability. Findings from the study have enabled communities to understand the issue of school-related gender violence a bit more. And that actually made them to come together to develop disability inclusive sRGB response plans to protect children. Finally, we need further research to understand the effectiveness of how these plans have been implemented. And we need to explore how local plans to protect children can be integrated in other violence prevention mechanisms at all levels. That is the district and national level. Thank you so much for your attention.
Good morning, everyone. My name is Lungle Twala from the University of Eswatini. I'm glad to be invited here. Thank you for affording me this opportunity. My topic is on addressing the cycle of school-based violence, poverty, and illicit student economies in Eswatini. This research study is from the whole region of Eswatini. Eswatini has 4 regions, and this one is from north. Okay. School-based violence in secondary schools within Eswatini present significant challenges to student safety and educational outcomes, particularly in the regions characterized by economic hardship. As I said, this study is from the whole region. So the whole region, it is common that students own farms for growing dagga. That is an illegal plant. So it is normal that as a teacher, you will find that you have a class, let's say, of 30 students. But in one of the days, you'll find yourself teaching only 15 because the rest are out to mend or cultivate their fields. And sometimes you find that in the middle of a class, a student will just run out because they've been alerted that police are around to raid the fields. So you find yourself maybe without anyone in class. And that what happens there, it could be somebody who has reported to the police and made an alarm that, oh, police are around, so children will just run out. And the following day, those that alerted the police, it could be one of the students, or it could be the parents of the students. So that will then dovetail to the school environment. So the fight will erupt in schools based on the reporting that has taken place outside school environment. But then it will come, the fight will be at school. So this study investigates the relationship between poverty, illicit economic activities, and violence among adolescent learners in the whole region, examining how students engaged in cannabis cultivation and sale to supplement household income and pay their school fees. Is it coming? Oh, it's not coming. Okay. So let us look at the poverty violence nexus. So families in the Northern Ho, they are living below poverty line. And there is inability to pay school fees, and there is also food insecurity and inadequate learning materials. So the economic hardship forces survival strategies. As a result, students engage in illicit dagga trade, and conflict arise over resources and territory, because while they are growing the plant, they know there are places where they sell their plant or their dagga. So if it happens that one of them encroaches to the area where they are doing their trade, then the fight will erupt among the students. It will not end at home. It will also come to school during break time or lunch time or even after school. And at times it is known that Fridays is the day to settle our scores based on their private activities. So there is also fear and retaliation that perpetuate violence. And teachers therefore resort to punitive responses that alienate students. So corporal punishment is not allowed in Eswatini, but it is practiced. It's not allowed in, I would say, on paper. The policy says there should be no corporal punishment, but in actual fact, it is practiced and it's severe. So what teachers do then, they end up using corporal punishment to punish the students, especially those that are fighting in school and also those that are missing classes. Because as I said, it's common that they will just move out. And the following day, when they come to school, they'll be punished severely. And also, this cycle continues without intervention because teachers, they are unable to maybe do right things, how to engage and how to counsel whatsoever, but they resort to corporal punishment. So this study is informed by the Acne theory of strain, general strain theory, which says individuals experiencing negative stimuli such as economic hardship may engage in delinquent behavior as a coping mechanism. And there are other scholars, as I've highlighted, that support the theory on the misbehavior and also coping mechanisms. Okay, this study is a mixed method approach which use a pragmatic research design combining both survey and the qualitative interviews for comprehensive insight. The data was collected from 200 students from grade 10 to 12. Those participated, responded to the questionnaire, and also 24 key informants across 8 schools in the whole region. So we used convenient sampling and also a structured survey for quantitative data. As I said, it was for every student in those eight schools. And those that participated in semi-structured interviews were educators, and the focus group discussions were students, and also a few community leaders also participated in individual interviews. So the data was analyzed through a descriptive survey for the quantitative part and the thematic analysis for the qualitative part. But I'm not going to go into details about the methodologies, so I'll just go straight to the findings. And as I said, key findings highlight that about 41% of the students witnessed or participated in violence related to Daga-induced dispute. So the reason for this was just to get the ideas on what kind of violence were happening in schools and what sort of conflict are they having, and just to get an overview. Mainly, the study was skewed on qualitative part. Though the primary contributing factors were fear of retaliation, peer conflicts and mistrust, limited psychosocial support, and economic hardship driving illicit activities. As I said, the student not necessarily want to engage in such activities, but it is more like a way of life because they have to survive. They have to pay the fees. The qualitative part indicated that there was fear and silence. Student fear reporting incidents due to peer retaliation, and also limited confidential reporting mechanism perpetuate silence and enable continued violence. So they are sometimes unable to report the cases because they fear that once it is heard that it's them that reported the incident, then there'll be a quarrel and there'll be a fight amongst them. And also teachers use punitive approaches which are dominant in the school. So instead of resorting to other mechanism, they decide to use punitive approaches, and that further marginalizes the student, and also they become so vulnerable. And also there is inadequate support from school because schools lack trained counselors and psychosocial support. So one of the teachers remarked, how do you think I can assist the student when I didn't get the training myself? So it's difficult for me to handle such incidents. As a result, I resort to corporal punishment. And also, the result revealed that there is violence the violence is intertwined with broader socio-economic factors. You cannot just say it's as a result of misbehavior or what. It's a systemic issue. And also, there are limited alternatives to illicit activities and lack of multi-sectoral coordination among the stakeholders. The recommendations are to implement school-linked livelihood activities whereby we develop legal income-generating activities through collaboration between Ministries of Education, NGOs, and private sector. Examples of that can include school guardians, or give a student vocational skills training, and also microfinancing schemes to provide alternative to illicit activities. And also strengthen the guidance and counseling services whereby teachers are equipped with or trained with counseling skills. And also foster cross-sectoral collaboration, like to coordinate effort across schools, social welfare agencies, and community policing and traditional leadership. And also implement community-wide awareness campaigns and engage parents in dialogue about economic drivers contributing to violence, because as I said, it starts from the families, then it dovetails to the schools. And also incorporate parental and household perspectives. That's the research I think maybe if we can focus on, like future research should include views of parents and the household members to gain deeper understanding of family economic pressures and also decision-making processes influencing student behavior. As I conclude, I would say school-based violence in the whole region is deeply intertwined with socio-economic factors, particularly poverty that compels students into illicit economic activities. So breaking the cycle requires a shift from punitive responses to holistic, support-oriented, and multi-sectoral strategies that address the root causes. By focusing on economic alternatives, psychosocial support, and cross-sectoral collaboration, stakeholders can create safer schools that serves as genuine spaces for learning and development. So schools should be safe spaces for learning, not arenas for survival. Thank you for listening.
Thank you, Slungile. I think we were all rapt in our attention to your presentation. So next we'll be hearing from Herman, who's joining us from Cameroon. Can you hear us, Herman?
Yeah, I can hear you very well.
Great.
Jenna.
Please go ahead.
Okay. Please, can you see my screen?
Yep.
Okay. Okay. Thank you once more for the opportunity given for the presentation of this work. Unfortunately, we couldn't be there presently due to visa issues, as the moderator actually said. Okay, but with these slides, I'm going to present a summary of our research. We are working on the architecture of school violence, and we want to deconstruct violence in Cameroon secondary schools. And we know that violence is actually we know that violence is actually, in terms of context, school violence is actually a universal crisis affecting both physical and mental health of students. And we see that in terms of peer violence, our data from the UNESCO shows that over 36% of learners globally experience physical fights. And this has not stopped as sub-Saharan Africa is equally included. And the trend is actually very high for this continent, where we see that 48.2% experiencing bullying, while roughly 36% face some physical attacks. And there is much more research that deals with peer violence, bullying, fighting among students. But we want to say here that with the recent trend in school-related violence, it has shifted from school staffs, that's from peer violence to school staffs, whereby this area is actually a neglected area. Violence towards school heads, violence towards teachers. And we think this is a problematic, where while student violence is heavily studied, violence towards teachers is often ignored. And when we look at we actually look at a cultural shift in terms of, especially in less developed countries, Africa in particular, where in those days or in the olden days, the teacher was seen as a role model. The teacher was actually respected. The teacher as a parent, for example, as a model has faded in Africa. There's a decline in respect for educational institutions. And normally, we have studied a lot of peer-to-peer violence, student violence, and there's an imbalance. We think there's an imbalance in the scholarly attention.
Send positive vibes for the connection. Okay, we'll give it another minute, and then we'll maybe move on and come back to Herman.
That we need more data school violence. Oh.
Maybe if I go here, it'll start working.
Okay.
Yeah, Herman, we can hear you.
I'm sorry. These are some of the characteristics of less developed countries. You excuse me for that. Can I continue?
Yeah, please go ahead. I think we lost about the last 1 minute, maybe. Yeah.
Okay, thank you. So I was actually trying to contextualize in a world manner the violence while putting some emphasis in Africa and with more deeply emphasis on Cameroon, an alarming reality actually. The current situation, according to the University Francophone Agency in Cameroon as of 2023, states that around 34.2% of teachers in Cameroon report being victims of school violence of all kinds, whether physical, verbal, sexual. And the escalation of these incidents has gone beyond insults to physical violence, leading to the death of teachers in major cities of Douala and Yaoundé. That has been a very sensitive issue, and that led to a global conference on school-related violence organized by the Ministry of Secondary Education in 2023. And after we look at the processes of violence, we attempted to look at the causes, the determinants of such violence. And a review of existing works shows that there can be individuals and social factors or systemic factors. On the individual factors, we have violence is mostly linked to masculinity, substance use, that is drug addiction. We have hunger and poverty for some authors. And for others, we have family dynamics, lack of parental mentoring, and high family conflicts. That is always the case in Cameroon. And we thought we took this variable seriously in the case of Cameroon because it's a major challenge here. Now, when we talk about systemic factors, we thought of students from influential communities and families, which is a very important variable to consider in this case. We have mental health issues among students' population. Though this factor is a little bit rare, but we thought that it was important to include it if at all we can see in our variable. So actually little is known on the profile and processes of violence towards teachers in the context of Cameroon, and little equally known on the causes, while the consequences are often visible. Now, we went further to create a research question that is, what is the prevailing profile of violence directed at teachers and school heads in Cameroon secondary schools? Which factors account for the rising frequency of this violence? And we set up some objectives, that is to identify the types of violence experienced by teachers and to analyze some of the specific influence of individual factors on social school level factors on this violence. Now, the methodology for this study was wide. We use data from the Francophonie University Agency, that's a French university agency, mostly in French, we call it Agence Universitaire de la Francophonie. Maybe some of you must have heard it. On secondary school transition, data was used. We considered only the data for Cameroon because This data was collected in more than 4 countries, but we consider data only for Cameroon for the specificity of these studies. Now, on the selection of our variables were selected based on the existing literature and country-specific context. And the variable, it is unfortunate that I've not presented the variable description, the descriptive statistics. The data analysis, we mostly use data for economists. We mostly use data for our analysis, for estimations. And in this case, we captured our violence variable as a binary variable. That is, either a teacher and school head were victims of violence, whether physical or verbal or not. So they answered 1 for yes, no otherwise, or no for 0 for no. So we were forced to use a logistic model. You could as well use a probit model, but we decided to use a logistic model due to the binary nature of the dependent variable. As you can see, that's verbal and physical violence for teachers and schools head. 1 if yes, 0 if no. We will start by presenting a version that is the profile of violence in Cameroon secondary schools. When we look at the profile of violence in Cameroon secondary schools, we'll start by school heads victims of violence. We see that for teachers who said, for school heads who said yes, they stand at 44.7% compared to teachers who has 34.2%. We must say that school heads this time around in secondary schools are victims of violence more than teachers. Though this result seems to be a little bit alarming, but it actually reflects the situation Cameroon is having now, with teachers and school staff having a lot of challenges with respect to violence from the students, from the parents equally. Now, the second strand of graphs decomposes the types of violence. We have, if you look at graph A, it shows the school heads violence from students. That's physical violence. We say that physical violence is a little bit low when we compare it to the graph B, which look at verbal violence from students. Verbal violence is a little bit 68.1%, as compared to physical violence is very high. Now, why we can say that we can justify this result based on the fact that attacking a school principal physically will seem weird for the student. Now, there can be slangs, insults for the principal as they try to put on discipline in school, especially during assembly days, especially during periods of the day when the students are out. We have school heads victims of violence from parents. Physical is very slow, though it's an important aspect, because this time around we have seen parents of students, especially parents from influential parents of students who are influential members in the country, in the society, would come in school premises and try to harass principals, even school teachers, as we can see in diagram G, whether it's verbal or physical. But the verbal violence is more renowned in terms of school heads. Now, all this diagram shows that the school heads are victims of both physical and verbal violence, but verbal violence is more accentuated as they try to put undiscipline in school. Now, if we move to the violence related to teachers, if we move to violence related to teachers, we see that violence related teachers from which is physical, we see a 28.1% as compared to verbal violence. We can see that verbal violence is still high as compared to physical violence coming from students. Now, the teacher is more in contact with the students, and there is more of insults, grievances, and it can escalate to violence. whether physical or verbal, but the verbal one is more pronounced in Cameroon secondary schools. Now, when we come to violence toward teachers from parents, physical violence is more pronounced. And this is because the parents actually, this time around, they come to class, they will see the teacher, for example, the teacher has undergone some corporal punishment on the student, and they will tend to harass the teacher, and they will tend to fight with the teacher. We have seen situations where the parent of a student that was a member of the armed forces indulged into a teacher's class and started molesting the teacher. We have seen situations like this in Cameroon. And so these results are not surprising. It just describes the current violence, school-related violence in Cameroonian secondary schools. Now, the second part of the diagram shows violence occurrence by the gender of school's head and teachers. We attempted to say that when we look at the violence, when we look at violence in terms of female or male, please, you discover that violence occurrence by gender of school head with respect to male tends to be lower as compared to female. Female gender violence is actually repeated because as if females are looked in the Cameroonian context as the weaker gender, and students might tend to be more, students might tend to like produce more scenarios of violence toward female students as compared to male, because they know that the male, for example, it can escalate and they can be punished for that. While the female are just looked at it and they don't think maybe something might happen or physical violence might result out of the verbal violence. And this is just a profile of violence in Cameroonian secondary schools. We went now to look at the determinants of this violence. Why would a student be violent toward a teacher or a school head? And when we go to it, it's unfortunate that we do not present the auto-ratios as we are dealing with introductive regression. But if we present the regressions directly from our estimation, the auto-ratios, maybe we've not presented, but we'll try to explain this. When we look at the student gender, remember that here we coded 1 as male and 0 as female. We discover that there is more chances that a school head is affected by violence from a male gender, whether verbal or physical, than a female student. Male students are mostly the ones instigating the violence. For example, the school head is there to put on discipline in school, and the male students are mostly stubborn. And then there is more chance that violence occurring to school heads comes from male students than female students. This is the context of Cameroon. And we looked at student home violence exposure, whereby if a student comes from a home or comes from a household where there's frequent violence, there's high chances that the student becomes violent in school, whether physical or verbal. There's high chances that the student exercises some actions of violence towards school set in school. And we went further to look at the school day hunger for students that are hungry in school. If they starve in school, there is high possibility that, or there's high chances that they become violent. And the explanation for this might be that a child that is hungry, that starves, will not be attentive in class or will not be attentive in school, and will be trying to dodge or be trying to go out of the school premises. That is what is actually happening in school milieux, because he needs to look for something to feed himself. And in the case of maintaining discipline for the child not to go out of the school premises, it can cause a lot of violence, whether physical or verbal. And we went to the gender of the school head. We said that when the school head, for example, the gender of the school head here, 1 was coded male and 0 female. As compared to the profile of school gender, we see that this result sounds a little bit contradictory, but we think that it reflects the context. If in the profile, females were female school head are more victims of violence, whether physical or verbal. Now, the gender can equally cause students to be can equally cause students to be to have violent behaviors, and we think that the male gender as a school head is more prone to violence because male genders are more physically strong, and they will try to exercise a sense of superiority on the students. And when we went further, there is experience of school head as a or experience as a school head. We do not underline that, but we see that in terms of verbal violence, there's a reduction in the chances of verbal violence once the principal has experience. In this case, he has experience in the management and the resolution, for example, of school conflicts, of students-related conflicts with the staff. So we have equally the parental marital status. We do not underline this, but it's an important variable. The parental marital status shows that if we code 1 as the child coming from a household where parents are legally married or they live both as husbands and wife, there is more possibility of controlling the child. There's a possibility that the child is well brought up, and it can have a negative effect actually on school violence, as compared to single-hood parents, whereby bringing up the child upbringing is a little bit difficult. And in the case of Cameroon, women are the ones left with children when the fathers try to escape, and they are forced to bring up the child alone and to cope with the attitude of the child once he grows up. For example, in secondary school, the child is already a grown-up person, and he needs to be well trained. And this one, the fact that the father is not around can actually cause the child to be have some violent behaviors because he's not actually well brought up in terms of correction. We are not putting here in case the upbringing of a mother, but we simply explain this in the terms of the context of the Cameroon, where we often see these things. Now, when we talk of the teacher, it's almost the same thing. When we see the student gender, it will affect, in terms of male, will affect the chances, that is, there's higher chances that a teacher is victim of violence coming from a male student, whether physical or verbal, though the significance level will change. Now, the student home violence exposure, we have the same results. We have the gender of the teacher. Here, there's actually a change because in terms of significance or in terms of science, because the gender of the teacher in class might matter. A female teacher might be more prone to violence because she's looked at if she's weak as compared to a male teacher who can actually put order in school. Now, from this result, though we await some questions, but from these results, if you take the paper, the organizers, you take the papers, you see the odd ratios. I ought to present the odd ratios, but I couldn't modify the PowerPoint lately. Now, when you look at some conclusion and key takeaway from this study, we see that male students are more prone to violence than their female counterparts. Students exposed to home violence who starve during school day and stem from single families are more likely to exhibit violence. And we see that teachers' experience measured by the years of teaching, the higher the educational level of the parents, you can see it from the results, and the probability of students having violent behavior in schools. Now, the study equally highlights the importance of school staff gender on students' violent behavior. And from this study, actually, we can draw some conclusions. We can draw some policy recommendations we can say targeted behavioral or gender-based intervention. Have implement specific intervention for male students to address gender-related violence. Empower school guardians and counselors to lead programs on social emotional learning, anger management especially, and non-violent conflict resolution. That is how to resolve conflicts without indulging into violence. You have social economic support and nutrition. We have, especially for hunger, you have established and funds feeding programs specifically for students from socioeconomically depressed or rural background to combat hunger-driven tension. We have foster partnership between educational authorities and the Ministry of Social Affairs to provide financial and referral aid to social support for vulnerable single-parent families. And regarding the teacher professional development and retention, that's a policy recommendation with regard to the teachers. That encourage formal discussion within schools where experienced teachers mentor newer staff on effective strategies for managing student violence. And we provide ongoing professional development to ensure all teachers master the art of classroom management. This is very important, the art of classroom management and non-aggressive discipline towards students. I think this is the quintessence of the summary of our presentation of our research. It has some limitations regarding some of the variables not included here and the way the variables were coded not included in the PowerPoint. We thank you for your kind and keen attention.
Thank you, Herman. I don't know if you can hear me now, but thank you for taking the time to share those findings with us, and also for linking your research to policy recommendations, which I think would have an outcome on student violence towards teachers, but also peer-to-peer violence. And these are the kind of interventions that we need to see across all schools. I'd now like to introduce Emily Eldred from London School of Hygiene and Tropical Medicine. Emily, can you hear me?
Hi, yes, I can hear you. Can you hear me?
Please go ahead.
Perfect. Okay. Okay, so good morning or good afternoon, everyone. I'm sorry not to be there in person and to meet you all. So I'm taking a step back from the previous presentations in this group and looking at the global evidence. And so I'm presenting results of a systematic review of school-based violence prevention interventions evaluated in randomized controlled trials. And I'm presenting on behalf of my co-authors who are listed at the bottom of this slide. So why does equity in school-based trials matter? So we all know the statistic that 1 billion children experience violence every year. However, the frequency and severity of violence victimization is often greater amongst minority and marginalized children, who often unfairly experience multiple axes of disadvantage. So for example, children with disabilities can experience twice as much violence compared to children without disabilities, and as we've heard from our speaker earlier. And the uneven distribution of which children experience violence is unfair, preventable, and unjust, constituting an inequity. So how do we conceptualize equity in this paper? So on the left-hand side, we have a picture describing equality, where the person on the right-hand side is given a box where they still cannot see over the fence. And the assumption here is that everyone benefits from the same supports. Equity in the picture in the middle, where the person on the right is given two boxes, the assumption is that everyone gets the support that they need. And then the long-term goal is justice, where the cause of the inequity has been addressed. So in this paper, we talk about health inequity as an inequality in health that is unjust, unfair, and preventable. So what guidance is there on equity in research? So firstly, there's Progress Plus, which is an acronym used to identify characteristics that stratify health opportunities and outcomes. And this can be a tool for measurement. There's Rep Equity, which is a toolkit for capturing a representative and equitable sample in health research. There's Consort Equity, which are guidelines to improve reporting of health and equity in randomized controlled trials. And I'll come back to why I've just mentioned this later on. So in our systematic review, we take an equity lens to firstly assess the extent to which minoritized children are included in universal school-based violence prevention intervention evaluations. Secondly, to identify which evaluations examined intervention effects amongst subgroups and conduct an equity assessment to describe the quality of inclusion within these papers. And then thirdly, to assess whether school-based violence prevention interventions are effective amongst different groups of children or have a differential effect by subgroups. So how did we do this? We searched 6 databases and also utilized professional networks to identify systematic reviews of randomized controlled trials of school-based violence prevention interventions. And we did this to recognize the large number of systematic reviews already published and to have an efficient search strategy. And then once we identified our final sample of systematic reviews, in which there were 29, we then hand searched the included papers in each review and then assessed them against our inclusion criteria. So that was randomized controlled trial, school-based intervention, violence victimization outcome, and outcomes measured amongst nursery, primary, and secondary school children. So we also developed criteria on equity to assess papers that included subgroup analysis. So we drew on some of the checklists I mentioned earlier, but took an inductive and deductive approach in order to develop this checklist. So this criteria, compared to the other checklists, is specific to evaluations of school-based interventions. So the first criteria was, is the research question or hypothesis concerned with measuring equity? For example, did it include some terms such as equity, difference, or subgroup? Did it compare a group with a comparison group of subgroup? Secondly, was the study powered for subgroup analysis? Was the subgroup analysis pre-specified, either in a protocol or statistical analysis plan? Was the method of analyzing and reporting the result appropriate? So, for example, we considered it appropriate if it was a subgroup-specific effect estimate using an interaction term and corresponding test for heterogeneity. Then, was equity considered in sampling? So was there oversampling of the subgroup or stratified sampling? Then, was equity considered in the design of survey implementation? So, for example, were there adaptations to consent for children with disabilities? Were there multiple languages of the survey? Was equity considered in the responses or referral plans? For example, were there adaptations to referral pathways for children with disabilities when disclosing violence in the study? Then lastly, was there any adaptations to the intervention content of the subgroups? So were there disability inclusive adaptations? Were there more representative materials? And then with our criteria, each study was given a score of 1 for meeting each of the criteria. So I'll come back to the results later on. So after conducting our systematic review, we identified 160 trials. But for this paper, we have this larger database of trials. But for this paper in particular, we're interested in violence victimization outcomes only. And we found 88 trials. So what were the characteristics of the studies? So the 88 trials mainly measured bullying outcomes, followed by IPV and dating violence. There was much less on teacher violence and gender-based violence. And these labels are based on the author's descriptions of the violence. Trial locations, trials were mainly in high-income countries, with only 21.6% in low-middle income countries. So the first research question, what characteristics were measured within the trials? So this is the table 1. So the majority of papers measured sex, so 83 out of 88 estimates. The least measured characteristics were gender identity, religion, and parents' housing. And we considered gender identity as opposed to sex, where authors included options for students to either identify as non-binary or ask students to self-describe. Okay, so coming back to our equity criteria. So out of the 88 trials that we identified, we then looked at the trials that conducted a subgroup analysis, and we found only 16 trials. So we assessed these 16 trials against our criteria for equity. So in terms of the first criteria, only 2 studies met this criteria. Only 4 of the studies were powered for the subgroup analysis. None of them had pre-specified subgroup analyses. And 3 out of 6 had an appropriate analysis and reporting of the result. 5 considered equity in sampling. So for example, in this paper, separate sampling frames were prepared for girls and boys. From these sampling frames, 23 girls and 23 boys were selected randomly from each school for the baseline survey. Then 6 considered equity in the design of the survey implementation. None of the studies considered equity in the response or referral plans. And 6 of the studies included adaptations to intervention content for subgroups. So for example, in this study, the facilitator and participating teachers role-played select program materials and exercises and discussed how materials might be adapted to account for varying class period lengths and student composition. So for example, mixed sex and IEP students, which is individualized education plans, which includes children with disabilities. So overall, 6 out of 16 met none of the criteria, 5 out of 16 had a low score, 5 out of 16 had a medium score, and none of them had a high score. And just to say also that this is based on what is reported in the papers. So of course, many of the studies may have done these adaptations, but just have not reported them in the paper. Okay, and then in terms of the last research question, what were the subgroup specific effect estimates? So although, as I said, we identified 88 RCTs, only 19 studies, which were reporting on 16 trials, estimated a subgroup specific effect estimate or estimate of differential effect. And these are by sex, by disability, by sexuality, by race, ethnicity, and by socioeconomic status. So one key implication is that we need more trials to be powered and have adequate sample size to grow this really quite small evidence base. Secondly, there were differential effects by subgroups. So for example, by sex, the Good Schools Toolkit, school-based intervention in Uganda, was found to be effective for both boys and girls, but the intervention was more effective for boys. Secondly, the SEHER intervention in India found an intervention effect for both girls and boys as well, but the intervention was more effective amongst girls. So one of the key implications here is that we need to check. We can't assume that interventions work for all children or work the same way for all children. Lastly, the evidence is not examining all subgroups. So most subgroup estimates were by sex. There is a large evidence gap on where the violence prevention interventions work for minority and marginalized groups of children. So interventions need to be tested and possibly adapted amongst different groups of children. So for example, for children with disabilities. And if adequate power is not possible, researchers could consider oversampling their target group. Okay, so implications for both research and practice. So starting with research, future school-based violence prevention trials could consider following the recommendations in our equity criteria, alongside the other criteria I mentioned, such as equity. So for example, powering trials to conduct subgroup effects by oversampling. Then future trials could consider measuring a range of socio-demographic characteristics in their sample based on context to know which children are within their sample. And funders could provide additional funds to create equity relevant trials. So for example, oversampling and funds to oversample. And then for practitioners designing and delivering violence prevention interventions could consider testing the intervention in different socio-demographic groups of children to understand their differing needs. So for example, multiple languages and training intervention facilitators in adjustments for different groups of children. So for example, disability-related adjustments. And then lastly, interventions should be designed to target the different structural, institutional, community, and interpersonal drivers of violence against children at high risk of victimization. So that can include targeting the reduction in stigma and discrimination and harmful gender norms. And importantly, these drivers might be different for different groups of children, particularly subgroups of children. So thank you very much. Our paper is now published, so I'm happy to share that if anyone is interested. But thank you very much for listening. And thank you again to co-authors.
Thank you very much, Emily. I've been told my mic now is working, so hopefully you can hear my thanks. So I'm sure that you've all got a lot that you want to reflect on after hearing those presentations. Unfortunately, we don't have a lot of time, but we do have time for one round of questions. So I'll just take 3 questions, and then I'll turn to the panelists and ask if you'd like to pick up on those questions that you think are relevant for you, just taking 1 or 2 minutes to respond. So sorry for the limited time, but let's make the most of it. So who has a question? Okay, one from Dave, one from over here. Okay. And then let me take the 3 now. You have a question as well? And over here? Jenny. Okay, thank you. Please go ahead.
Thanks so much. So I think, 2 questions. One is for, sorry, to get the names, I have to look at my thing. One is for Rice on the question, on the issue of teachers and school leaders experiencing violence. I'm curious, in the course of this work, whether you heard, I know it was, you were using this data set, but whether you heard anything about sort of potential impacts on kind of recruiting or retention of teachers or turnover, if there's any impression that this is one of the drivers of, of teacher retention challenges, which are common in a lot of countries. And then, Emily, thanks so much for this. One of the things I'm interested in is related to your last point about kind of redesigning interventions. And I'm interested how much you think we should be doing more testing of existing interventions, like, with bigger samples and targeted samples to test for kids with disabilities or other differences, right? Versus testing more kind of innovative, differently designed interventions for kids, like the balance between those as we kind of look forward with not unlimited budgets.
2 for the price of 1.
First of all, thank you all of you for the presentations. My question is from S. Lungile. I'm just curious enough to know that if students are selling cannabis and making a living out of it, what is the core reason of it being promoted? Is it poverty or ignorance of parents or of the students around people who are letting them do this? Thank you.
Thanks.
Hi, thank you. I'm also going to squeeze 2 questions in. So one for Sungliwe,
Yes.
which was really lovely study that you described. I think really gave me a strong sense of the way we need to think about the context of violence, which you did very nicely. My question for you is really about whether you looked at gender at all, because you have a very clear analysis of what was going on, but I wondered about whether you looked at all about the gender dimensions, both for girls and for boys, in your analysis. And then my other question was thinking, it was kind of a little bit more sort of for everyone, but particularly for Stephen and also the Eswatini case, was about the ethics. None of you said very much about ethics, and I was thinking particularly where the studies where you were doing work with children in groups, I wondered how you dealt with issues like confidentiality when you're discussing such personal, sensitive and sort of taboo subjects.
Thank you. So I think at least one question for each of you. So let me start with Slangile.
Thank you so much. The driver of this selling of cannabis is mainly poverty. That's the key driver of selling the cannabis, because parents are living below income level of Eswatini. So therefore they resort to poverty, to selling cannabis to supplement their income. Thank you. And the issue of maybe it didn't come out clear whether girls or boys, but mainly there are boys who are involved in such conflict than girls. And also the ethical protocols were followed. Children consented, so they were asked to consent and they freely agreed to participate in the study. Thank you.
Thanks. Herman, let me turn to you next on the question of whether there was an impact on teacher recruitment and availability.
Yeah, actually, thank you. I hope I'm being heard. The question regarding there is an impact on the teacher's experience. We think the policy in terms of retention is actually a major question in our country, especially in many countries in Africa, retention of teachers. And we believe that if teachers, we took an example of teachers' experience, we took that variable and we saw that it was positively correlated. No, it was negatively correlated. I mean to say, when we look at the results, we see that schools had teachers have experience in school can manage violence in a better manner. Now, we believe that if teachers are retained, experienced teachers are retained, it can have an impact actually on the fact that violence will not be widespread in school because they will know how to manage it. Now, when we looked at, permit me to look at my auto ratios. If you look at the auto ratios in terms of school head, experience as a school head, you see that in terms of verbal violence, there is more chances that a school or a teacher that has experience is going to reduce as violence by 0.9 point. Though the impact is not really good, though the impact is not really high, but we believe that if teachers are retained and they are more trained on how to manage conflict resolutions by older teachers or by teachers that have experience in the teaching field, it can help reduce the level of violence in school milieux. I don't know whether I got the question very well, whether my answer suits what the person was expecting.
Thank you, Herman. You're getting a thumbs up from the room. So you addressed the question. Thank you. So now let me turn to Stephen for the question on ethics.
Yes, ethics. Of course, we got a study first approved by the ethics committee nationally, and then we secured consent from the parents first and then from the children before they participated in the study. We were aware that we were discussing very sensitive things. So one of those first things we did was to give children unique ID numbers so that they don't use their names, in case somebody goes through the transcripts at any level. But then we also took the children through the issue when we do our discussion that they don't call names, they don't mention names, they don't mention spaces. No, they don't mention situations at all. So we guided them so that when they give their experiences, they just refer to issues and not names of anybody in the community or anybody that can be identified by anybody that was part of the focus group discussion. But also, sometimes the discussions were quite stressful. And so what we did before the study, we developed safeguarding protocols so that once during the discussion, we discovered that somebody in the room was feeling a bit distressed, we were able to identify that person and take that person out of the room to a safe place to find out reasons why they are distressed. But then finally, because we were talking to children separately, we made sure that we discussed with them in a very safe space. So no teachers or school staff were permitted to be part of the discussion. I hope I answered that question correctly. The person wanted it.
Thank you, Stephen. Finally, let me turn to Emily.
Hi. Thank you, David, I think it was, for your question. Really interesting question. So I think I'm going to say actually a little bit of both. So I think it depends a little bit on what stage the intervention is at. So if the intervention, there's a lot of fantastic school-based interventions out there. So to say that we need to redesign all of them will be that are already tested in randomized control trials might be a bit of a challenge, and it might not be necessary. So what I would consider is testing existing interventions in either trials or process evaluations. But again, if you're designing an intervention within disability research more generally and within violence, it's recommended to take a twin track approach to violence prevention. So mainstream interventions are inclusive. That could include, depending on sort of what type of violence that is being targeted, it could be that teachers get additional training on children with disabilities. And then secondly, the second part of the twin track approach is to include targeted parts of the intervention as well, either as part of the intervention or as like a separate intervention. So for children with disabilities, that might be improving referral pathways that are maybe not accessible because it might involve going in person, or for kids with communication disabilities, it might be that they have to call a number. So I would say, yeah, I haven't given you a final answer, but I think some testing for existing interventions, and then and they can be adapted in the twin track approach, and then for developers already designing interventions, taking that twin track approach. Thank you.
Thank you very much, and thank you again to Herman, Slungile, Emily and Stephen. And I think today's presentations have really demonstrated how there's no single set of drivers that can explain school violence, and that we really also need to focus on the characteristics and the socioeconomic situation of the children and the wider school community that we're working with. So thank you, a lot to think about. And let me close the session there.
Thank you, everyone. Just to say that we will have a shorter break, so only 15 minutes, and we should be back at 11:25 for the next session. Thank you. We're going to start the last research session of today. Welcome, everyone. We started this workshop with a session going through evidence that analyzed what works to prevent violence around the schools. We learned a lot from that evidence, including that schools work also as an entry point to reduce violence that happens not only inside, but also outside of schools. And in this last research session, we will go back to the evidence to explore what works to prevent violence in and around schools. So let me welcome our moderator, Luis Benveniste, Global Director for Education and Skills at the World Bank.
Thank you, Gabriela. It's great to be here. It's great to be here at CGD. Welcome to all for part 2. So we're going to continue the conversation that we started at last session, and really sort of again continue to really debate and delve into sort of what to do about school-based violence and how to really get our heads around as to what can be done. I was just looking at some numbers that came out recently from the Afrobarometer, and there was a question about sort of the share of girls and young women that sort of experience discrimination, harassment, or sexual favors from teachers at school, and the estimates were as high as 70% in Gabon, 55% in Cameroon, 40% in South Africa, 35% in Uganda, and the list goes on. So it's this is really a serious problem, and again, I'm really delighted to be here to go through 4 different papers that sort of look at sort of both what can be done and in what ways that we can have impact on the ground, and also some lessons from experience as to things that did not work as well, and so what do we learn from them. So we'll hear from Sophia Fritzon-Reitner from the World Bank. She's going to talk to us about intervention in Zambia. Then we're going to hear about from Rangoli Srivastava about again an intervention in India. Then we're going to hear from Monica Mensah Dankwa from the University of Ghana, who's going to talk about libraries. And then finally, Isis Gadis from the World Bank as well, talking about sort of a transportation intervention in Pakistan. So welcome all, and I very much look forward to the papers and the conversation after.
Hi, everyone. My name is Sophia Fritzon-Reitner, and I'm a social scientist at the World Bank's Africa Gender Innovation Lab. And this is a panel about what works, but I'm actually going to talk about what doesn't work, which I think is actually really valuable in the process of trying to figure out what does work. We often uncover what doesn't, and that information doesn't always make it to presentations like this. And I think it's especially valuable when we have really rigorous mixed methods evidence to kind of tell us why we think it didn't work. So spoiler alert, I'm going to talk about what didn't work. This was a collaboration between lots of people across lots of institutions, as is evident on the slides. And so I am presenting on behalf of a large number of people. And I'm going to share my slides now. Maybe? No? OK, so now you can see. Large collaboration, lots of people. OK, so you've already seen a presentation today on school-related gender-based violence, but I think there's a couple important things that I want to point out. I think it's important to remember that SRGBV is not just sexual violence. It's physical, psychological, and sexual violence. And it happens not only to girls, but also to boys, and it can be perpetrated by both boys and girls and men and women, right? So it's not just an issue that affects girls, and it's not just sexual violence. And I think it's also important to know that SRGBV occurs in and around schools, and it results from gender stereotypes and norms that are enforced by unequal power dynamics, right? So this is a specific form of violence within schools. Okay, so I'm going to be talking today about the empowerment pilot, which was a multi-component intervention to try to address SRGBV in Zambian secondary schools. So this was implemented in the context of the government's Keeping Girls in School program, which was housed within the Ministry of Education. And as background context, KGS is a cash plus approach to social protection. So KGS beneficiaries come from households that are on the government's social cash transfer program. And these adolescent girls within these households are then provided education grants and are provided with boarding fees when needed to help get them into school. And so in 2023, KGS realized, okay, we're getting all these girls into school, and girls are experiencing violence in school, and it's not just girls, it's boys. So the government decided that they wanted to try a pilot to address SRGBV in secondary schools. So in 2023, they piloted the empowerment pilot in 3 districts in the last 2 terms of the 2023 school year, and the Africa Gender Innovation Lab partnered with the government to conduct a rigorous mixed methods impact evaluation to evaluate its success. So since the program was implemented in the context of KGS, the program was targeted to schools that were serving KGS beneficiaries, and it was for grades 8 through 12, but in some schools, lower secondary education is offered in the primary school facility, so grades 8 and 9. So it was targeted in both senior secondary schools, 8 to 12, and also primary schools that served grades 8 and 9. Okay, so I think it's important that everyone understands what this program was, since we're going to be talking about why it didn't work. So the empowerment pilot consists of 3 primary components. It's a multi-component intervention, and all 3 components are delivered by trained teacher mentors. And these trained teacher mentors are drawn from the existence, guidance, and counseling staff within schools. These teachers participate on a voluntary basis. They receive 5 days of training prior to program start, but they do not receive additional compensation, and they do not receive relief from existing teaching responsibilities or guidance and counseling responsibilities. So it's an additional responsibility on top of what they're already doing within schools. There are 3 primary components. I would say like the most robust component is the learner's curriculum. And this consists of 17 one-hour sessions that are delivered through safe space clubs after school by the trained teacher mentors. And these safe space clubs consist of gender segregated clubs, so 25 boys and 25 girls per club. And it is delivered in the form of a structured curriculum, right? So the teacher mentors are leading adolescents through activities. And they're covering a range of topics, including gender and equity, gender equality and positive role models, awareness of gender-based violence, SRGBV, communication for respectful relationships, bystander intervention skills, and help seeking and peer support. So it's a pretty comprehensive curriculum delivered over the course of 17 weeks. And these sessions aim to build knowledge and shift attitudes around gender and violence. And club members are also expected to engage the wider school community around topics that cover each of these core areas of the curriculum. So the idea is you're making the individuals responsible for then going out into the school community and kind of sharing this knowledge beyond club participants. There's also a comprehensive teacher's curriculum that's meant to complement the learner's curriculum. And again, this is delivered by these same teacher mentors, and it consists of 11 sessions that are 1 hour each that are delivered to all teachers in relevant grades within participating schools. And they are delivered, or supposed to be delivered, during regular staff meetings. And this curriculum addresses children's rights, gender and SRGBV, creating a safe and supportive classroom environment, responding to SRGBV, and reducing corporal punishment and using positive discipline. So these 2 curriculum are supposed to reinforce each other, and by including all teachers, you're now not only targeting those in clubs, but you're trying to kind of get this, this kind of culture change in schools into the wider school community. And then there's also a third lighter touch component, and this focuses on parent-teacher engagement. And this is really just a one-time meeting with the parent-teachers committee where the teacher mentors go and they introduce the program so parents are aware of what's going on in the school, and then they encourage parents to come up with ways that they feel like they can support the reduction of violence in schools. Okay, so to assess the impact of the empowerment pilot, we employed a triangulation design for the mixed methods evaluation to offer a comprehensive and nuanced understanding of the intervention's impact. So from the quantitative research, we focused on assessing the effects of the intervention on knowledge and discussion of violence, attitudes and norms around gender roles and SRGBV, experiences of violence, perceived school climate, and socio-emotional well-being. We measured violence at 2 time points, so past term, which was towards the end of implementation, and then past 2 weeks, which is 4 months post-implementation. We also, in the qualitative research, we aimed to understand the norms around violence in schools, the perceptions of the intervention, and the potential mechanisms through which the intervention generates its outcomes. Okay, so we conducted a cluster randomized control trial with the intervention randomized at the school level. We used administrative data collected in the beginning of the 2023 school year by the Ministry of Education to identify all schools located in the 3 study districts. And since the government was focused on implementing in schools that had KGS beneficiaries, we selected schools that had more than 10 KGS girls enrolled in grades 8 to 11. And so this produced 90 eligible schools, and we randomized 45 to the intervention and 45 to the control, stratified by district, boarding school, and the number of girls, KGS girls in the school. You'll have to take my word for it, but school characteristics were balanced. Happy to share that. You can look in the paper. For the 8 schools selected for the qualitative data collection, they were very similar to the rest of the schools in the quantitative sample, although we over-sampled for boarding schools and remote schools because we wanted to kind of have a distribution of the different types of schools within the qualitative sample. So the empowerment pilot was multi-component. It targeted a subset of students through clubs with more intensive programming, but the goal of the program really was to reduce SRGBV school-wide. And so the impact evaluation was designed to measure the effect of the empowerment pilot on the average student in study schools rather than the impact on club participants specifically. And that's the takeaway from this slide. To do this, we randomly selected 25 boys and 25 girls each from participating schools. And then we kind of had this separate sample since the government was particularly interested in KGS beneficiaries of all KGS girls that were not sampled through that random sampling. So that means we had the all-student sample that consisted of the randomly selected boys and girls, or sampled boys and girls, some of who were on KGS and some of whom were also participating in clubs. And then we had this additional KGS sample, and that means we were able to analyze in the data, and I'm not going to go into the depth of this in the presentation, it's in the paper, but that means that we can kind of look at what happens to boys, we can look at what happens to girls, we can look at the differential effect, we can look at KGS girls who have higher participation in clubs. There's a bunch of different ways we're able to cut the data by drawing our sample in this way. So for the qualitative data, we collected data from 8 intervention schools at 2 time points. One was at the beginning of implementation or kind of midway through, and one was almost at the end. We had a total of 72 interviews, 28 focus group discussions with 8 participants each, and 14 observations of safe space clubs. And for the focus groups and in-depth interviews, we had a mix of participants who were in the clubs, boys and girls in the clubs, boys and girls not in the clubs. We had teacher mentors, female and male teacher mentors, and then in a subset of schools, we also talked to non-mentor teachers as well. Okay, so our findings. I think not surprisingly, given everyone's work on violence, we find that violence is widespread in schools, with both quantitative and qualitative data pointing to a pervasive culture of violence. Right, so Zambia does away with corporal punishment in 2003. Physical violence is largely corporal punishment, and we can see that it's quite high. Boys and girls, I think it's important to note, have relatively similar experiences of violence in school, right? Boys and girls are both experiencing sexual violence from teachers at the same levels, but girls are slightly more prone to sexual violence from peers, and boys are experiencing slightly more sexual or physical violence from teachers. Schools with higher levels of teacher-perpetrated violence also tended to have higher levels of peer-perpetrated violence, kind of indicating that adult and student behavior are mutually reinforcing, and that this kind of indicates to us that there's a pervasive culture of violence in schools. Okay, to our results, there aren't many, so this is quick. Really, the only place that we see sustained impact is on the discussion of violence. So we see an 8 percentage point increase or 47% increase in the discussion of violence. And from the qualitative data, we know that that discussion of violence looks a lot of different ways. Some of it is club members talking to each other within club sessions. The topics are violence. They talk about violence within the clubs. Some of this is teacher mentors making school-wide announcements during assemblies that may pertain to some message about violence from the clubs. And a lot of it is passive discussion of violence, or what I would call passive discussion, where kids not in the clubs know that these clubs are going on. They know that they're about violence, but they're not necessarily like talking about violence specifically as much as kind of the topic is there. And so by and large, we take this increase as an indicator that the intervention actually happened in these schools. That's what we think this tells us. Beyond that, we do see small kind of suggestive changes in attitudes and norms towards gender roles in SRGBV. We see some suggestive changes in bystander reporting, but none of this withstands multiple hypothesis testing. We also see a 2 percentage point decrease in sexual violence from a control mean of 6%, but it also does not withstand multiple hypothesis testing. So taken together, we take this to suggest that the intervention sparked dialogue, but it was insufficient to shift a culture of violence in schools and probably not a very cost-effective way if that's what you want to do. It's quite intensive and expensive. Although I don't have the costing data, so don't ask me for that. Okay, so what did we learn from the qualitative data? I think that One Girl Not in the clubs really kind of sums it up. Quote, nothing has changed, end quote. That was the pervasive feeling that we got from adolescents. Adolescents' lived experiences reflected complex and ingrained gender attitudes and norms that shaped their everyday experiences of violence in school and were very hard to change. So for instance, corporal punishment, the most common form of violence, was often framed as an acceptable response to correct student behavior. This was often a violence begets violence approach where students internalized the message that violence is acceptable and justified. Stereotypical assumptions about how boys and girls behave influenced teachers' disciplinary practices, right? So it wasn't just that it was violence, but there was kind of this SRGBV component to the corporal punishment. Adolescents reported that boys and girls were punished differently for the same infractions. Boys were more often subjected to harsher physical punishments, such as whipping, caning, beating, or being made to dig pits or latrines. Girls, on the other hand, were more frequently assigned chores like sweeping, watering plants, carrying water, or cleaning the school compound. So any changes observed as a result of the intervention were minimal, indicating small shifts towards exercising greater restraint rather than changes in school culture or stronger accountability mechanisms. So a female mentor described the change this way, quote, the punishments have been reduced, whipping has reduced. If a teacher wants to beat learners, they should give at least 2 strokes and not too hard. There was also a pervasive culture of victim blaming that was found, where girls were often blamed for the harassment. Teachers and adolescents and teachers alike often described girls enticing male teachers into sexual relationships or into boyfriend-girlfriend relationships, placing blame on girls for the experiences of violence. Okay, I'm going to speed up here. So what are the key takeaways? So what did we learn from the fact that this didn't work? I think this is really a simple point, but it matters. Feasibility is key. Right? If you design these multi-component interventions that look really great on paper and they can't really be implemented because you're relying on overstretched teachers, implementing after school with not enough resources, your program is not going to work, right? So feasibility matters, not what it looks like on paper. Number 2, clubs alone are insufficient. So there's been a discussion about kind of what are the components that are necessary to have effective programming. And while this was a multi-component intervention in practice because of implementation challenges, it really just focused as a primarily a club-based approach. And we know from our data that KGS girls who participated in the clubs in higher numbers. We know that schools that had higher levels of implementation, none of those groups saw better outcomes, all pointing us towards the takeaway that clubs alone are probably not enough. And then the last 2, my time's up, so I'm going to really wrap this up. There were challenges with program design and that system strengthening is key, and these 2 things go together. So this was a program that really targeted knowledge, attitudes, and norms change within the individual and did not address kind of systemic school governance gaps or accountability mechanisms. And I think we've seen this throughout the presentations that we are implementing these programs in the context of existing school systems. And there is, I think, a big missing question about what are the minimal things that need to be in place within school systems to layer on programs that are attitudes, norms, shifting, culture shifting interventions. And I think what we see is when you implement attitudes and norms change interventions and you don't have those kind of foundational reporting mechanisms in place or accountability practices, you're probably not going to see impact. And so there should probably be a stronger emphasis on kind of these core system strengthening components. And thank you. That's it.
So it's almost afternoon here, but it's night in India. So with all the anxiety and jet lag, a very good afternoon to all of you. I'm here to present my research. And many of you might be wondering how, as a dentist, I made it up to here. So I'll just connect the dots. In my specialty, as a public health dentist or as a community dentist, we go to schools or in urban, rural areas to check the oral health and to provide treatments. Now what happened 1.5 years back when I went to schools,
I noticed a change in the perception of the way the children looked at me or my team. And this perception varied from school to school. I always was in that dilemma that actually there is something called as fear of white coat, but it cannot be that much evident. So that made me think there is something beneath what I can see and I can perceive. So my target was to improvise the oral health or to improve the oral health literacy. But somewhere I thought that at this point of time, I should try to understand what is happening with these children. So it all started with that camp story. And this particular model was implemented in Gurgaon. Gurgaon is basically a district and it has got both urban and rural areas. So that gave me a good opportunity to compare both the vicinities, and as along with this, there was qualitative and quantitative approach. So to begin with, just to bring some gray literature, 80 to 88% of children were affected. That is the gray literature. There was no proper study that was done in my area. Now, as thanks to AI, this is an imaginary Indian Brooklyn Bridge, which is trying to just show that what is the gap that is present. So gap is very evident. There was no evidence on basis of what I can proceed to. There were unknown mechanisms, like I could only see children being reluctant for dental treatment or to have a conversation with me. But I didn't know the mechanism. Where's the fault? Is it with the children? Is it with the teachers? Is it with their parents? Is it with the community? Is it with the school? Or is there anything else? And the context matters because urban and rural schools have got a different projection in India. In urban, we have lots of resources. We have accurate teachers. But in rural schools, we don't have that much staff, as we can say, and resources are also very less. So I was very curious to go through this process of understanding why is it happening in both urban and rural schools. Then we have sustainability questions, because if I'm proceeding towards this research or this model, it has to be sustainable. Like this particular model has to be sustainable in terms of long-term efficacy, or this model being implemented in any other part of India or somewhere else. Moving ahead, research objectives primarily being just to assess what is the efficacy of my model, and along with that I needed to know what is the urban-rural scenario and what is the mechanism of change, and further so that I can take it ahead towards policy integration. Now this is a very complicated word for me to pronounce, Bronfenbrenner's social ecological model. It actually says if you have many levels of interaction, you need to have an activity at all the interconnected levels. Like as I said, I didn't know what was the reason behind it. Was it the children? Was it the parent? Was it the community? Was it the teacher? Was it the school? So basically I thought to intervene at all levels. And to keep it very simple, as the title says, it's not that much complicated. It is somewhere a mixed method approach. So at student level, I just proceeded towards integrating empathy in those students through many sessions. At teacher level, see, just to cite an example, if Gabriela is my senior, she's my manager. If she scolds me for some reason, out of nowhere, I can't show my anger towards her because she's my senior. I will get it out on some other category where I cannot get a response back. And the most common target is the students, because I am also a faculty. So whenever I am being scolded by my manager 2 years back, I used to get it out on children. Like if I'm having a lecture right now, if someone is coming 10 seconds late, that student will be scolded for 10 minutes right away just for getting 10 seconds late because I am angry from my own reason. So somewhere at teacher level, this was inculcated in them that if they need to make the students disciplined, there is a positive approach towards that. You don't need to get it in a very negative way. Then coming to the school level, there was something called as School Climate Index that was analyzed before and prior. So the environment of the school was somewhere analyzed before and after our intervention, and it was drastically changed in a positive way. Then at community level, definitely we have parents, we have school teacher meetings at the point of interaction where a teacher interacts with the parents. We observed that, we got to know many of the remarks, we just saw where is the difference and where is the perception going wrong. Moving ahead to the methodology, it was somewhere a 1-year mixed methods cluster randomized control trial. It was basically a baseline, proceeded by intervention, proceeded by final data analysis. Then we took 16 rural schools, 16 urban schools, and majority students were from class 5th to 8th, and they were randomized both into equal groups. Moving ahead to the comprehensive approach for teacher training, as I said, I am also a faculty. 2 years back, when I entered academics, I used to be that person who used to get my anger on the students because I cannot get a response back. I did a faculty development program in my university, which changed the way I look at students. So I was very much into that thing, that if I am that person who is getting into this thing of taking students at a lower level, getting my anger on them, why not the school teachers? There might be a very huge probability of them also reacting the same way, because it's one or less the same thing. We both are faculty, we have students who cannot respond back to us. Then we have student empowerment curriculum. There is something called as calm spaces in our university. It actually works only on empathy. Developing empathy amongst a group of students or children, primarily to make them understand each other's situation so that the concept of bullying never happens, or they can provide a safe environment to their friend who is having a troubling or a tough time. Then parent engagement circles, this was quite limited in number, but still we were able to interact with the parents just to let them know, if you want your child to grow, you don't have to necessarily punish them. You can always help them in a positive way, and many other counseling sessions right in the way I just cited an example. Then safe box reporting system. This was something unique in my study. While we were having this intervention in the rural and urban schools, we introduced a safe box in their own vicinity in the schools where they can anonymously report if there is any violence they actually faced after the intervention was introduced to them. So somewhere they felt comfortable in reporting that violence if anything happened, and in each school there was a committee associated with that particular safe box, and that committee was nominated by students themselves. So it's not that we are suggesting someone to be a safe box volunteer. It was nominated by students. On that faculty they have a trust on. Moving ahead to the data collection, there were some questionnaires and surveys we did before and after, including UNESCO School-Related Violence Questionnaire, Strength and Difficulties Questionnaire, Teacher Attitudes Towards Discipline, School Climate and Safety Index, and School Records, basically tracking the attendance and the academic achievements, be it the first sessionals we entered and the third sessional marks. So this is what we assessed. And all of it was done under the ethical guidelines, keeping the acts in mind, like POCSO Act and NCPCR guidelines, which is for children of India. And there were some baseline sample characteristics of the age distribution, gender and location, and grade distribution amongst the students. Then the baseline characteristics showed that 77% had digital access, 68% belonged to nuclear families, 42% were from lower middle class, all of it just to figure out if there is no confounding factor intervening in our research. Then proceeded towards the implementation part, in which I have already explained teachers were trained, and these training was like a 3-day faculty development program, which actually, in my opinion, changed my perception. So definitely there was assumed that they would also have a positive impact. Then students were also reached. As I said, calm spaces is something which our university is associated with teaches empathy. So students were also reached. And what made us believe that there was a good success was based on the retention rate. Like there were 96% retention rate throughout the sessions and throughout the FDPs. Then we have the outputs like 85% session attendance and 92% usefulness rating. Moving ahead to the baseline and after intervention measurements, there was a 47% school violence reduction. Initially, it was 47.2% in these schools, and after our intervention of interacting with the students, of interacting with the teachers, of interacting in the school, of interacting with the parents and introducing safe walks, it came out to be 24.6%. Along with that, there were some other measurements we noted, like teacher physical violence. It reduced from 28.5% to 11.8%. So as I said, if you have issues with anyone, you will reach out to the students to get that anger out. That was reduced. Peer bullying was also reduced, and the credit goes to the calm spaces for particularly having that empathetic value inculcated in the students. Also, we could see that dropout reduction from schools was 57%. Academic gains, as I said, academic marks were noted, and there was strength and difficulties improvement in questionnaire difficulties reduced from 20.3 to 15.6. Then also there were some secondary outcomes like positive discipline adoption. As I said, we interacted with teachers and parents, and we made them aware of the fact that if you want your child to be disciplined, if you want a student to be disciplined, you don't have to negatively punish them to be a disciplined student or a child. And there was reduced punishment endorsement, like empathy was somewhere inculcated in the teachers and parents as well. Moving ahead to the school climate and community engagement outcomes, school climate was drastically transformed. The children felt safer to come to the school, and this will be evident by one of the qualitative remarks I'll be showing forward. So after all this intervention, the best remarks I have just noted. From a teacher, she said, "Now I talk, not hit." From a student, it came out, "Safe walks makes me feel safe." And growth in empathy and peer support, like students demonstrated enhanced emotional awareness and willingness to support classmates. We help when someone cries. So as I said, empathy will help them in being a better person. Bullying was something which was drastically reduced, and if someone is having a trouble or a tough time, then they have a friend to listen to. Also, additional was like parental norm change, urban-rural implementation differences, pathway to institutionalization. We are in the longer run trying to go to every particular school in the vicinity of Gurgaon to have this system implemented. Also, this mixed methods validation confirms the impact based on the end line remarks we have received. Along with the remarks, the values that we are seeing, it somehow confirms the impact of this mixed method approach. Also, we have a proven model for safer schools. As we can say, there was 47% violence reduction. There were 4 key outcomes that were attended to, and 32 schools were transformed. So I would like to conclude by saying you can't educate a child who feels unsafe. If I crossed the borders from India, I'm traveling to USA because I felt safe here. I was looking forward to this opportunity, and I was so excited to present my work, which I never thought will get an international platform. So thanks to CGD, and same applies to students as well. If they'll feel safe, they'll look forward to that. And thank you so much.
Thank you very much. Good afternoon. Just like the dentist, I know that a lot of you are wondering why I'm here. My name is Monica. I'm a librarian. I have practiced librarianship for a decade, and I have moved from librarianship to academia. I would just move straight to my avatar. So that is me as I'm standing here. I wanted to tell you about my university, but I don't have the luxury of time, so I would move on very quickly. So why am I here today? I am here for just one reason. One reason why I am glad to be here, because as the dentist said, I wanted an opportunity, and I've always looked for an opportunity to showcase what libraries can do, what libraries are, and what libraries provide as far as all interventions are concerned. And school-related violence is one of them. Maybe it's based on personal experiences as a child when I was growing up and how I looked up to the library. So today, I am here for one reason, to tell you about how we can reimagine libraries to go beyond books as hubs for school-related violence prevention, especially in low and middle-income countries. And to be able to do that, although I'm a librarian and I'm teaching in the library school, I have all the evidence, but you know, in academia, evidence is based on scholarly work. So what I did with my team was to conduct a scoping review where we looked at the literature across low and middle income countries to come up with some strategies that libraries can actually bring up as far as school-related violence is concerned. I would not bore you with the introduction, but what I have to say is that right from yesterday till today, we have all witnessed that school-related violence actually has a negative impact on meaningful learning and educational quality. And this is more prevalent in low and middle-income countries because we have problems with infrastructural gaps and resource constraints. Now, listening to you all yesterday, I realized that there are some traditional models that we think that we have accepted, that these are models to actually prevent school-related violence. But I'm here to tell you that there is one particular entity within these schools, especially when it comes to low and middle-income countries, which have been overlooked as partners within preventing school-related violence, and that is libraries. So I am here to tell you about how libraries can translate all your policies and big interventions that you have into daily, simple routines that can be implemented in schools. So as I said, I had 3 objectives. The first one was to map the regional and country distribution of school-related violence-related evidence in low and middle-income countries, and also examine the types of violence that are prevalent in low and middle-income countries. And I will not bore you with all that. I will just run through quickly. But what I would give examples on, I know that during question time, there is no time limit, so you can ask me and I'll talk a lot. But I'll rush through this. So I would like to explore the roles of libraries as well in school-related violence. So just the methodology. We've had methodologies on systematic review. It's the same thing, just that in scoping review is some sort of an exploratory research where you're not clear whether there's a lot of literature. So we use the Trico and ASCII and Molin model. And then here, the model actually goes through some systematic process of identifying the research questions, identifying relevant studies. We used some databases, which I'll show you very soon. We also consulted gray literature, policy documents, and then we used the Boolean operator, the or and the and operator, if you understand scoping review, to actually come up with our assess strategy. We did some truncation to pick up variants as well. And then our assess strategy was done, and then we ran it through the Prisma flow chart, which I'll show you, and then we chat the data, and then we came up with findings. So this is what the Prisma flow chart looks like. So at the end of the day, we got about 1,284 articles that were talking about school-related violence and libraries, but we wanted to really find out which of them were actually talking about strategies that libraries actually have come up with to implement some of the interventions of school to prevent school-related violence. So after title review, after duplication review, after abstracts screening, full text screening, we had only 47 articles, and the databases we used are on the other side, Scopus and Google Scholar, plus other policy documents. So these were the findings. Now, when you look at the first box, objective 1, we were trying to find out country and regional distribution as to which countries these publications were coming from. And we realized most of them were coming from sub-Saharan Africa. Out of the 47, we have some from South Asia and some multiple country studies as well. Now, the reason why most were in sub-Saharan Africa was that some of our exclusion criteria was that the article should be written in English because we didn't have the luxury to interpret those ones from the Francophone countries. And therefore, it's biased towards that, and that's one of the limitations of the study. Now, as you can see in the other, I think I'm standing this way. So this side, the objective 2, you can see we try to look or map out some of the school-related violence or some of the violence that are more prevalent or that are more common in low and middle-income countries. And as I said, I will not bore you with that because we have talked about since yesterday. As you can see, they are all there: fighting, cyberbullying, corporal punishment. All these came out as some of the violence areas. But what I would like to talk about briefly is the role of the library in school-related violence. Now, yes, I agree that since yesterday, all the presentations have said, oh, we need a multiple approach. And I know that I walked up to some of you and you said, oh, the library is involved because we in the school, we all agree that we are fighting school-related violence. But what I'm here to advocate for is the deliberate and conscious effort to bring in libraries as partners in preventing school-related violence. Why am I saying this? Libraries are safe places. These are safe places which are supervised. And the activities that are done in the library are activities that could help implement some of these interventions of school-related violence. Let me mention a few of them. Libraries provide digital, as I've indicated there, libraries provide digital literacy and information literacy services. This is an opportunity for us to leverage on so that whenever we want to actually implement some of these school-related violence interventions, like yesterday I heard about AKASI. I don't know whether I stand to be corrected if AKASI is supposed to be an online form that is supposed to be filled. The libraries are there. And this is what they do because during digital literacy, they have to tell the student how to use the system, etc. Libraries provide orientation. And some of these services are services that we can incorporate some of these interventions into so that we can implement them at a very low cost. I know there will be questions for me. I just want to run through. And then libraries also provide what we call the bibliothekal or bibliographical, bibliotherapy services. And bibliotherapy services are just guided reading groups. And from the research that I read, I realized that some researchers in school-related violence have actually indicated that group reading or guided reading can actually reduce aggression and build empathy. This is something that libraries are doing already. So when you bring libraries on board, we help at the stage of implementation. Another thing that I would love to talk about is noise. You know, in Africa, I don't know about the other side, but in Africa, and typically in sub-Saharan Africa, and in Ghana, where I come from, we live in homes where we call face me, I face you. Face me, I face you simply means that your house is here, my house is here, our rooms are facing each other. And there are so many families living in one compound and there's so much noise. And research has actually indicated that noise actually elevates something called cortisol. And you know, cortisol actually is a stress hormone, okay? And then when people experience that, then they become aggressive. Libraries are therefore they are safe places for them. So when you come to my country, and especially in Africa where we have the civil society, there are libraries everywhere in these schools. These are units that are everywhere. We have the public libraries, we have the school libraries, we have libraries within the primary schools. And so these are entities that are low-hanging fruits for students to actually go into to be able to be served. And therefore, these services that libraries provide every day can just be tweaked a little to provide some of the services that will be tailored towards preventing this school-related violence. Another thing is about bystanders. You know, I read from the literature because I'm very interested in this. I have a special story around it on school-related violence. So anytime there is violence, we realize that there are bystanders there who witness. And sometimes they don't know what to do, they don't know how to go about it, etc. There is evidence in the literature out of the articles which shows that libraries actually have certain corners, or they could have corners in the library which are called bystanders hubs, where they could receive some services, where they could get some orientation on what to do when there is any violence that they are witnessing. I think the last but one thing that I'll talk about is that in Africa, we do not have the luxury of having internet. And some of these interventions, I don't know, I stand to be corrected. I know that when they have to report, apart from the boxes, when they have to report, maybe they have to use a mobile phone, maybe they need internet. Libraries, however, in these African countries have free internet for children in the schools. And so it is also an avenue for children to be able to report some of these school-related violence within the library. And especially in Africa, we have what is called the third-party syndrome. Children, from research, shows that children do not sometimes feel safe reporting issues to their parents, because in Africa, our parents are a little bit, once you report something, we are holding your hand and taking you straight to the school. The child is embarrassed. Or you report to your teacher, like we heard from Sierra Leone, the teacher says, oh, don't mind them. So sometimes the child looks for the third person to report to. And there are evidences that normally when they come to the library, and the library is for them, so they always come to the library, and normally when they come to the library and they see the third person, they report to the person. So the library could become that third person for them to report their issues to. And I've also spoke about the internet. It's very free for libraries. Akasi, if it's an internet-based system, can be hosted on the library website. And then orientations are done around it, and other interventions that you have which require that we need internet to be able to report to. As I said, I'm not going to talk too much, but this framework actually outlines most of the things that libraries can do, as I have outlined also in the full paper which I have shared. So I have already discussed my findings as I was talking. So the findings are there. Now, what are, I'm not going to talk about limitations because I've said it already. I've already indicated that we only included English. Oh, I was told I have to go back this way. Okay. Good. So as I already mentioned, there are limitations to this study, although it's a scoping review and went through all the processes to gather the evidence. We actually had only English published articles. We relied on Scopus and Google Scholar, so other researchers could actually look at other areas as well. Now, the conclusion is that, very simple, there is an entity within most school systems in Africa, in low and middle income countries, that have been ignored. And I am just advocating. I am not saying that libraries could stand alone as a program. No, what I'm advocating for is that libraries could be great partners as far as reducing or preventing school-related violence is concerned, especially in low and middle income countries. Okay, now, so that is it. That is the end of my presentation. I'm waiting for questions. I did this presentation. My time is not that bright. Then I can talk about appreciation. So I want to thank the Center for Global Development and your team. In fact, as I said, I have a story to tell. When I was young, my parents were abroad. They left me with my auntie. I experienced a lot of bullying. I had to be in the boarding house at the age of 4 years. And I was always in the library because I always wanted to talk to somebody. So this issue has been with me. School-related violence has been in my head since I was 4 years. And I thank you for actually making me speak on this today and showing how libraries helped me 4 years ago and how they can help today. I want to also thank my university for giving me permission. I had co-authors on this particular publication, which we started a long time ago. And so when we got this opportunity, I decided I have to put in to be here. And so Dr. Atu Yangson is a lecturer in the University of Ghana, the Department of Physics, who is so passionate about school-related violence. And then I had Dr. Okoji from Nigeria, who is also passionate about school-related violence. She's a librarian. And then Dr. Osei Tutu is an education person. Okay, thank you very much. I think my time is up.
Good evening, or good afternoon, everyone. I'm not coming directly from India, but I guess my mine is in another time zone. So it's a pleasure to be here today. This is joint work with Sofia Amaral, who's sitting over there, and Kate Viborny. And we're talking today about bustling girls to success, experimental evidence of middle school buses in remote areas. So to get started, I want to talk a little bit about the context of our study. So the study is situated in Pakistan, which, unlike many other countries in the world where we've seen a closing of gender gaps in education, or often girls even surpassing boys, Pakistan still has sort of these first-generation gender gaps. So girls are less likely, particularly, to attend secondary school and to complete secondary school. Within Pakistan, we see that the province of Khyber Pakhtunkhwa is a major contributor to this gender gap. So 5 in 10 girls in the province never complete post-primary education, and there's a 51 percentage point gender gap in school enrollment among 10 to 14-year-olds, so a massive gender gap. It's a province that's directly at the border of Afghanistan and where these issues really predominate even compared to other areas of the country. Now, what is at play here? There's a mix of factors. So from our baseline, we see that 76% of families say that it is unsafe for a girl to travel to a middle school alone. And this is, I think, what ties this paper to the topic of this conference, even though this is not about a school-based sort of violence prevention program. It is a program that is embedded in a context where concerns about girls' safety on their way to schools are very, very salient. And the intervention itself included a number of provisions that tried to make transport safer for girls. But it is not safety alone. We also know that transport to school can be expensive. So in our baseline sample, school transport costs make up about 13% of household education spending for those with a daughter in middle school. So there are clearly also affordability issues, as well as accessibility issues, in a sense that not all the communities in this area are even served by private transport providers that would allow girls to travel to school by some form of private transport. So here comes this is where the Safe and Affordable School Journeys program comes in. This is part of a World Bank project, the Khyber Pakhtunkhwa Rural Accessibility Project, and the program provides free group school transport for girls to attend public middle schools in the rural areas of the province. It is no coincidence that the program targets middle school, because middle schools are really sort of a cliff where many girls drop out of the education system. And this is for a variety of reasons. The first reason is that primary schools tend to be closer to the girl's home. They're often in the community, but the middle school is often further away, so there's a distance effect. The second reason is that distance in this context, it's not sort of a continuous concept, but there's a lot of research by others, Ali Shima and others, that shows that there are sort of these discrete community threshold effects. So it is much easier for a woman or a girl to travel or move around within the community than to sort of leave the community. And so again, because these middle schools are not always in the same community, this is a particular concern. And then last but not least, also the transition to middle school coincides with a period in a girl's life where they often enter puberty, and then these concerns about safety, gender-based violence are heightened. This program is very much grounded in local communities, so each school's parent-teacher council recruited drivers from the same communities, and parents were mobilized through campaigns and school meetings. The program included a host of measures to prevent gender-based violence, and again, this is, I think, why it ties very nicely to with the overall concept or the overall topic of this conference. And a lot of these measures were informed by previous evidence on the importance of trusted individuals, so people that, that are really trusted within communities, and also the importance of sanctioning systems. So my colleague Sophia has published on this topic. The parent-teacher councils recruited local drivers and assigned chaperones to the vehicles in an effort to make transport safer. Drivers had to sign a contract with PTCs with responsibilities and sanctions, and they signed a pledge committing to their role as agents and champions who would promote safety and support girls' mobility to school. PTCs and drivers received dedicated trainings on safety and GBV protocols. You see some of the sort of snapshots here from the manual. For example, drivers were instructed to never take unauthorized pictures of girls, etc., etc. And there was a specialized firm supporting GBV trainings for school staff and drivers. And the reporting and grievance redress mechanism was established to respond to any harassment or violence incidents. And all vehicles had to display the helpline numbers to all the passengers. Talking about the study, so how did we proceed? In terms of the sample, we first started with a sample or list of public middle schools, and we created so-called school clusters. So essentially, we took the middle school and their feeder primary schools, and these would form a school cluster. And then a middle school is selected for the study if at least one of its feeder primary schools is remote. That means more than 1.6 kilometers from the nearest middle school. That was sort of the distance threshold that was introduced by the project team. And girls were only eligible to be beneficiaries of the project if they had a distance of more than 1.6 kilometers. As the next step, we conducted a listing exercise to identify girls meeting these eligibility criteria. In particular, we went to the feeder primary schools and we enumerated or listed girls currently enrolled in grade 5 in the 2023-24 academic year. So these are girls essentially just at the cusp of transitioning to middle school, where this threshold or this risk of dropout is very salient, as well as girls who had completed grade 5 previously but had not transitioned. This is also an important aspect of the study. So the project deliberately targeted out-of-school girls, and we made an attempt to include this group of girls also within our study population, because this is a group of girls who are very vulnerable often and where we do not often have good tools to bring them back into the education system. So we are very keen on including out-of-school girls also in the study. And then within middle schools, we enrolled girls in grades 6 to 7, as well as those who had previously dropped out. And you can see on the right-hand side of the slide, you see sort of a graphical visualization of these school clusters. So I think if I can see, the red ones are the control clusters and the blue ones are the treatment clusters. And it's a bit hard to read, but there's sort of always this middle school at the center and then all these feeder primary schools that serve that middle school. In terms of treatment assignment, we randomly assigned about half, or slightly more than half, 85 of the 164 school clusters to receive the program, and both eligible out-of-school girls as well as registered girls were informed of the scheme. And as some of my previous presenters in the sessions, you have to take my word on the fact that treatment and control clusters are balanced. But we do have a slide, and we can also look at it later. We conducted a range of data. We collected data through a range of methods. So we had a household baseline survey, a school student listing survey, household short-term follow-up. This was really important to us because we wanted to feed information back to the project team very early on to allow them to course correct, to flag any issues of implementation, and also get a sense of early results. We conducted school audits or attendance spot checks. We also have administrative data of enrollment and attendance. These two data sources are highlighted here because most of the sort of outcome measures that I'll show come from these two data collection exercises. However, we do have a more detailed parental and student endline data collection that is currently underway. We're just preparing for rollout. Once this data is available, we can talk much more about downstream effects, but this is sort of the first time we're presenting this paper, and we're sort of so far focusing on some of these primary, or like more on the primary outcomes, such as enrollments and attendance. And then we also conducted a driver's baseline assessment to understand the extent of driver's characteristics, GBV, and gender bias. An important and, we would argue, novel feature of our study is that we, as much as possible, try to unpack accessibility and safety. So, as I mentioned in the introduction, there are a number of reasons why girls may drop out at higher numbers than boys, especially at that transition from primary to middle school. So one potential reason is accessibility of transport, which can have gendered effects. If girls are disproportionately worried about sort of concerns about safety amongst girls, to understand that better, we want to conduct heterogeneity by baseline access to a full-pay school group transport service. So we try to see if if it's just the fact that this new transport is subsidized, which matters, or is it the fact that there simply wasn't any way for girls to take any sort of motorized transport to school prior to this new government scheme. We also try to test for the relative, or we try to explore safety features more. So within treatment, we implemented a safety salience information experiment where a random sample of drivers received monthly calls reminding them of their roles, safety protocols, and sanctions. We tried to introduce a credible threat. So we informed these drivers that a random audit would be conducted, whereas people would check on whether they follow all the protocols, etc. And the objective here was to raise the sense of accountability of these drivers in the absence of a sophisticated law enforcement system. The primary outcomes of interest here are perceptions of safety on the vehicle and driver's behavior. And to the extent that this treatment impacts safety, we can also potentially use it to disentangle treatment effects on girls' enrollment. In terms of outcomes, our primary outcomes are school enrollment, grade completion, and attendance. Secondary outcomes include learning, commute experience, parents' perceptions of safety and commute quality, school expenditures, girls and parents' gender attitudes, aspirations, and social norms. So some of these sort of more violence-related outcomes, I think, will feature more prominently once we have our end-line data collected, and then we can also present additional information. So maybe we can come back in a year's time and present a full sweep of results. And we're testing for additional effects on mothers and female siblings. So let's start with a few statistics from baseline that really help to contextualize this study. So first, we collected baseline data on parents' willingness to pay for daughters' transport to middle school. And the key takeaway here is that parents state at baseline that group transport will change the enrollment decision. This is really important because this reinforces and supports our theory of change of why this intervention might matter for girls to close gender gaps in enrollment. So you see here on the right, or basically on this graph, you see basically parents' willingness to use a van that's provided by the government at different price points. So if you start with the most to the right, at 6,000 Pakistani rupees, which is, I think, just over $20 US per month. Only about, I believe, just over 20% of parents said they would use the van to send their girls to school at that price point. Almost half of the parents say they just wouldn't send their girls to school at all, and the remaining parents would say they would try to send their girls to school through some other way. At a price point of 3,000 Pakistani rupees, it looks a bit similar. So slightly higher percentage of parents that says they would send their girls to school at this price point. And Pakistani rupees 3,000, that's about the actual cost that it is required from the government right now to provide this service. So you can see it is kind of pricey from the perspective of parents' willingness to pay. So parents would be unlikely to pay the full cost of this transport, or only a small fraction of parents would be willing to pay. And then if you go further to the left, you see that there's a big drop-off in the number of parents that say they would avail themselves of the transport once you move from free transport to 750 Pakistani rupees. 750 Pakistani rupees is just under $3 US, and yet we see this big drop-off. So about, I think 80% of parents say they would use a transport if it's provided free, but only just over 50% say they would be willing to pay even that relatively small amount. And that decision, or that statistic in particular, is the reason why we recommended to the government to make this transport available for free, because we were worried that with such a high price sensitivity that parents would not be willing to pay even at relatively low price points. And this is how it was rolled out, so the government agreed with us. What we do also see is that the parents' willingness to pay does not differ very much on whether the pickup is from home or from a stop within the community, 15 minutes walk from home. That is actually good news from an operational feasibility perspective, because it is much more operationally feasible to have, say, a couple of pickup points within the community than to do door-to-door pickup for every girl. And again, so we were encouraged by that parents do seem to, so that like a 15-minute walk to a bus stop or a pickup stop does not seem to be a prohibiting factor for girls to send for parents to send their girls to school. And again, this is sort of consistent with these papers that suggest that it's really traveling outside of the community is where sort of norms and mobility restrictions are most binding for girls and women. Our baseline data also underscore that safety is a big concern on the minds of parents. So, for example, almost more than three quarters of parents say it is unsafe for a girl to travel to and from middle school without any family member. So, I mean, there are a range of statistics here, but most of them support the fact that this is a context with strong restrictions on girls' mobility and conservative gender norms. And because of that, we think that a collective transport solution with a strong focus on safety is most suitable for this particular context. The literature has evaluated other types of transport solutions, more individual solutions, such as, for example, the provision of bicycles, but we do not think this would be an adequate means in this particular context because of these strong gender norms, but also to some extent because of the terrain, which is very hilly, roads are not in a good condition, etc. Now, talking about effects of the intervention. So these are first stage effects collected from a household, I see it, I'm almost done, household follow-up survey shortly after the intervention was rolled out. So we do see a large increase in the number or share of girls who are using group transport to get to school, which is sort of what we were expecting. Now coming to effects on school enrollment. So here you see cumulative density functions of enrollment by grade, and we see all of them, in all cases, for all grades, the treatment line is to the right of the control line. So this is good news. It does seem that treatment sort of moves or increases enrollments for all grades. However, it is only significant for grade 6, where we see an increase in enrollments by 28%. Overall enrollment increases by 15%. But again, this is based on and I didn't say that, but this is based on administrative data from school. So it is a relatively small sample size, and we will get more power once we move to individual data collection. So this is good news. And if we do some very simple extrapolation, our estimates suggest this could reduce the gender gap by almost a third. However, there are two main caveats, and I'm just going to briefly wrap up here. But these are important. So one is that one reason why we might see these effects if there are spillovers or displacement effects, right? So parents in control school may hear about the transport intervention and decide to send their girl to a treatment school that offers transport. So we cannot really test this at the moment because the data that we have are school level, but we can do something that sort of gets at that issue, is that we interact sort of the treatment effect with remoteness. And if this is sort of a displacement effect, we would think it would come predominantly from schools that are close together, because then it's much easier to switch. However, we see the opposite here. We see that if anything, our effect is more driven by remote schools, which is more consistent with a genuine treatment effect. So this is encouraging. And then the second exercise that we also did is we did not fully trust these administrative data. First, they're always a bit noisy, but also here in this context, you could see sort of some degree of collusion between drivers and school officials to sort of cash in the government subsidy and sort of artificially inflate enrollment numbers in treatment schools that doesn't reflect any change on the ground. So for this reason, we conducted sort of a school audit, attendance spot checks, where we literally counted girls who were in attendance on a given day. And the encouraging news is that overall these results point into the same direction. They are weakly significant for grade 6, but again, we think this is a bit of a power issue since this is a sample of schools, and we'll have more power once we move to individual data collection. Just very briefly, next steps, we'll complete the end line. We'll be able to measure downstream outcomes. We'll also extend the study to additional districts. We're already working with the government to ensure an effective scale-up. This is already informing also interventions in other provinces in Pakistan, particularly Balochistan. And the main takeaways, we show that addressing mobility concerns in remote contexts can improve girls' enrollment among those with the highest risk of dropping out by about 28%. And I just want to give a shout out to a fantastic team. We have amazing junior collaborators. We also have a very good working relationship with our government counterparts, who I think some of them are actually connected today, even though it's very late in Pakistan, but they were so interested in listening to this presentation. And so many thanks to everyone who contributed here.
We have about 20 minutes for Q&A now. And so thank you, Izzy, thank you, Monica, thank you, Rangoli, and thank you, Sophia, for the presentations. And we're opening up to the floor for questions. We'll start with you there in the back.
Is this on? Yeah, it looks like it is. Okay. I'm Ishani Kanpal. I'm a senior fellow here at CGD. First, just very briefly, a moment of appreciation to my colleague Gabriela Smarali for a really rich set of conversations that she and her colleagues have put together. Just amazing workshop here. First, a question to Isis. I guess two, if you'll permit me the privilege. Where do private schools come in here? You know, I'm thinking of Jishnu, Natalie Bao, Noreen's work, for instance, on the very vibrant private school sector. It might be a different province, different situation. Those might be primarily primary schools, but just a little bit more context I think would help me understand what the set of parents is we're talking about. And then also, I wondered a bit if you were signaling something about overall school quality as well to the parents, not just about the safety of the transport, which is clearly a critical barrier here. But given how well integrated this program was, I did wonder about the signal about overall safety. And then last but not the least, you know, with the drivers, there's so much training, there's so much sort of implementation fidelity that I think you can control at the pilot scale, at the pilot stage. I would just be very cautious about that risk, you know, the sort of implementation fidelity issues coming up later when you scale up. And then very quickly, just to the dentist, Dr. Srivastav, really fascinating study. I was wondering if you had any data on, or if you'd explored heterogeneity by caste. In particular, if you can exploit variation in the caste or the religion of the teacher and the student. I think that'd be super compelling. Thank you.
We have another question here.
Thanks so much for the great presentations, Krista Ridley. I wanted to ask Sophia about her study, and I guess the question I had was, I didn't quite understand why you were linking the failure to school clubs being this lone strategy, whereas you said that they were also doing the teacher training and the work with parents, because I'm wondering if the failure is more due to the effectiveness or the design of the program, because I've seen programs that have those three components be effective. Teachers, parents, you know, kids, so it makes sense. And I think one of the elements of effectiveness on norms change and attitude change is not lecturing people, but having these reflective sessions where they can really think about what does it mean to do corporal punishment versus positive discipline, and encouraging positive discipline and showing how that can be more effective for the kids, for example, and talking to parents about something similar, so the whole community is kind of behind those norms. And obviously that's not a day, you know, a 2-month project, it's a longer term kind of piece of work. So I just wanted to ask more about that. Thank you.
Thank you. We have a question back there.
Thanks. Karen DeVries, London School of Hygiene and Tropical Medicine, and thank you so much to all the panelists for great presentations. And I am also feeling very excited that now I can count among my colleagues in the violence prevention movement a dentist and a librarian. So I love this. So a comment/question for Sophia. So first off, I love that you've come and presented something that has not worked. And I think that is so important, and there is so much we can learn from that. And also as a person who's done kind of multiple trials of different interventions, like everybody knows the Good School Toolkit, that's famous because that one worked. So I get called up all the time, like, can you tell us about this? The ones that don't work, no one ever rings me up to want to talk about that, but I feel like I've almost learned more from those in terms of things that can push the field forward. So yeah, I'm just wondering if you can reflect for us on your journey in kind of presenting these results and how that's been received. Yeah.
Thank you very much. I think this is just a general question, and it's like trying to tie in what we listened to yesterday to what we're listening to today, and thinking about scale up and fidelity and dosage. And I think one of the things that I heard in the first two presentations was this notion of trying it across different schools. It was a randomized control trial, so it was, but what does that mean for scale up if we want to roll it out nationally? For my colleague from Ghana, I think I've been libraries from my gender space and work. I've realized that girls are more likely to go to libraries and more likely to visit, be in clubs, whereas boys are more likely to engage in sports. And so I'm wondering, as a basis of school-based violence, where can we bring in all the different structures where we are getting boys, girls, and sometimes, hopefully, gender diverse wherever it is legal, And then my colleague from Pakistan, I think this is really, really great. I would be very, very interested in understanding how this translates in terms of agency, because we know that girls disproportionately are affected by this. But how does then community violence that happens affect these, like transportation, these mechanisms? So just thinking about violence in the environment and how that translates into schools.
And just let me take one more question here, and then we'll go to the panel.
Hi, I'm Naira Kalra from the Population Council. Thank you so much. This is such an exciting space to be in and talk about things that are working. And like my colleagues, I'm also thinking about scale. So my question to you, Dr. Srivastav, is to really think about how these findings and this intervention can be taken and scaled up. And when thinking about that, I think what's happening in India is with the Ayushman Bharat and lots of other initiatives in schools are increasingly becoming a bit like, and teachers are becoming a bit like ASHA workers, where they're doing everything in addition to teaching. So as they get overwhelmed, I've noted in a lot of our interventions at the council that teachers' willingness to take on more is a factor. Schools' leadership to buy in is a huge factor. And you had a fairly large number of schools. So were you able to see a heterogeneity where there was school leadership that wanted, to sort of take this on versus not? And also in terms of the teachers, did they volunteer? Were they forced to do this? Was there a difference? Because when you take these things to scale and you don't do them with people who want to do them, you see very different results. So I'd love to hear more about that. And sorry, can I tap on another second question? Quickly, heterogeneity-wise, ACES, I'm really interested in also learning more about what you guys are thinking about safety of the route beyond just needing a bus. Sometimes, and I'm talking from sort of the bus intervention in South Africa that were trying to do similar things in schools, they found they were finding qualitatively that routes with police station presence or those kind of things were safer. So just in case you're not finding results, are you powered to sort of look at route safety? And I think Ishani's already brought up the fact that school safety itself, the school they're reaching at, the province sort of more at the broader level. I hope you're able to see that. All right, thank you.
Great, thank you. Maybe we'll start with ISIS and we'll work our way back through the panel.
Yeah, so first, thanks for the comments. So starting here with the issue of private schools, I don't think private schools in this setting are very widespread. They're relatively rare. However, I mean, to the extent that, as we sort of have our student listing, we will measure if a student, for example, attends private school. So we can look into that a little bit. But it is not a very widespread phenomenon in this context. In terms of implementation fidelity, yeah, I think this was a big concern for us as well. I remember this was raised early on in our technical advisory committee meeting. We conducted a range of sort of exercise, a data collection exercise, but also to some extent implementation support exercises to get a bit of a handle on that. We had at some point spot checks where I think enumerators were observing if sort of the buses were arriving on time, the vehicles, do they have the required safety features, is it in good condition, et cetera, et cetera. So we may be able to say a little bit about that just from sort of a descriptive level, but that is certainly a concern that we had. In terms of sort of these, and I think this came up through a number of comments, these sort of broader spillover effects on communities or within the schools, I'm not quite sure. We will measure, I think, experiences of violence during transport in our end line. I'm not sure we have questions that ask, for example, about school violence in the sense that perhaps the transport intervention and the efforts with parent-teacher committees, could have spillover effect into schools themselves. So this is something that I think we could look into if this is something we can incorporate in our next sort of in our end-line data collection, which is about to roll out. And then, yeah, sort of the features of the route. I think it's an important question and a useful question. We have to dig into what is doable. Maybe we can do some. I mean, to the extent that we can geocode, for example, police stations, et cetera. There may be things that we could potentially do, but I think I'm not right now fully aware of the availability of data.
Great.
Okay, thank you very much for the question. I think that when it comes to gender and the usage of libraries, research, especially in low and middle income countries, have mixed results. Some have reported females using the library more. Some have reported males using the library more. But I think what works best is for us to look for interventions or areas or strategies to get both the male and the female into the library. Yes, some research are predominantly saying that females use it more because some have given reasons as females wanting more quiet places to read, whilst boys want the sports. For instance, a typical example in Benin, what they did on this, I remember there was an intervention for usage of libraries by boys. And I think that one of my partners there, some of the research that I read, what they did was that, for instance, they look at certain measures or certain things that were more enticing to boys to visit the library, like having a TV room in the library so they can watch their sporting activities whilst in the library and go back to read. Some other things that the library did, which they already have, is digital literacy. And so they met these students in their spaces. And that is what I said, that libraries already have these digital literacy programs. And therefore, when it comes to cyberbullying, for instance, they could leverage on that to help both boys and girls in that area. So it's a mixed result anyway, but what works best is bringing in the best strategy to attract both based on what they need more.
Yeah. So first of all, thank you for the questions. I would like to answer the first very interesting question of having caste and religion and its effect on this particular study, if it is significant or not. First, I'll be taking up caste. So I would just like to trace one incident, that safe box that was introduced in my study in the schools. So there was one safe box chit which came out, and in there it was written, I didn't brought a notebook today, and I was supposed to do the homework, and I was asked to get out of the class. But day before yesterday, one of my classmates did the same thing, but she was allowed in class. So after getting that note, that why that same student doing the same circumstance has been treated differently, we went on to that student. Unfortunately, the name was written of the student. So we went to that student, and somehow we got to know that that student who was allowed in class, that student was from a higher caste, a higher socioeconomic status. And the one who was asked to get out of the class was unfortunately from a lower socioeconomic group and from a lower caste. So in India, being a secular country, and with people moving towards Delhi, because it's the national capital, we have lots of people who are living around Gurgaon as well. So when it comes to socioeconomic status, there are some castes in India which are confined to higher socioeconomic status, and there are some castes in India which are confined to lower socioeconomic status, being the SC, ST, scheduled castes, scheduled tribes. So caste had a very significant relation to school violence. Coming to religion, any other important significant finding I came across in religion was that we selected schools on the basis of urban and rural category. Now the ones urban were like Catholic schools, convent schools. The rural ones, the government ones were like Hindu-based schools. So there was a difference in the prayer pattern. And while we studied and while we got into the Catholic schools, Muslim students or Sikh students or any other religion which is not Christianity, there was no significant finding. The violence that was faced by a Muslim student in a Catholic school was equivalent to more or less a Sikh person is facing in a Catholic school. So fortunately, religion had no significant association with school-related violence in our vicinity, but caste did had. So I hope I'm able to answer it the best way possible. Coming to the RCT concept of randomized control trial, being a public health dentist, being from community dentistry, all I can say is when we go by hierarchy of research, the best being meta-analysis, followed by systematic review, followed by RCT. It's the best evidence that can be traced out to population, be it in terms of reaching the public, in publications or anyway, randomized controlled trials are the best as compared to any descriptive or analytical study that is to be done. Also, there was a question related to volunteering of faculty. Now, this is a very interesting incident. What happened was, before we approached schools, we had this 3-day faculty development program being introduced. Now, when we went to the school, we told the principal it has to be for every faculty. It's compulsory for every faculty. And they were not interestingly coming to our FDP. And right the moment they entered, the school timings were somewhere like 8:30 to 2 o'clock. So right moment they entered, they were asked to switch off their phone and keep it on one side. That increased their anger because we Indians are used to having phone every now and then. So they were asked to keep off their phone. But by the second day, just because of the impact of FDP, they were so looking forward, like before we entered at 8:30, at 8:25, they were at the venue, keeping their phones aside. Because the concept of FDP revolved around how you can interact with adults and teach them something which they are not even volunteering to know. Because we are into adult teaching. So if I want to interact with you guys, I'll have to take it the way I am dealing with an adult, not how I'm dealing with a student. So that adult teaching approach, andragogy, was there in FDP. And they were told tremendous ways how they can deal with students, with various notorious children, and it was very interesting for them. So yes, to start with, they were not interested. They were like, go away. But by the second day, third day, they were grateful and they were looking ahead to more FDPs in their school. So thank you. That was for the question.
Sophia.
Thank you for the question about the clubs. I want to clarify, I don't think the evidence suggests, and I don't think that the reading of the study suggests that the clubs are the reason the program failed. I think the program was ineffective because of implementation challenges and because of design challenges together, those two pieces. I think in that process, we learned something about clubs though, right? So because we had implementation challenges, the most implemented piece of the program was the club component. So in some ways, it was a heavy club-based program. And through that process, I think what we learned about the clubs is that not that clubs don't have value, but that clubs alone that target a subset of students are not enough to shift a culture of violence in schools. And so I think that's the takeaway. And I think it's an important takeaway because clubs are often a go-to first line in programs and in schools. And I think that the message we want to get out there is there's nothing wrong with clubs, but if you want to reduce levels of violence in schools, you're probably not going to get that with a primarily club-based approach. So I think that's the message, and I think that's what we learned from a program that didn't work but had heavy club implementation, and we have data behind that to say, look, even when clubs were better implemented. And even when larger percentages of kids, like subgroups of kids, got that club component, and even in schools where we had higher levels of club implementation, we don't see better outcomes. So we don't think that better implementation of clubs or better spread of clubs is going to lead to better outcomes. Therefore, we don't think that a primarily club-based approach is the way to go. So I think that, hopefully that answers the question about the clubs. Question about journey to presenting null results. It is a journey, for sure. I think that this was a large research team with a lot of different researchers from different institutions and different backgrounds. We have people who are authors on this paper who are from the Ministry of Education. People have different incentives tied to the research. And so I think we spent a lot of time getting everyone on board with the message that while we see small shifts, kind of suggestive shifts here and there, we really kept coming back to the question of like, what is the overall takeaway message from this research? And if the goal was to reduce levels of violence at the school level, did this program work? And that is kind of what was our guiding light in interpreting the results. Because there's a version of this paper, and there are versions of this presentation out there that actually spent a lot of time parsing the kind of suggestive results that we get, especially the one on sexual violence, because it's like a pretty substantial reduction, but it's not robust. And so I think the takeaway for us was we needed to get everyone on board with the message, the key message, which is this program doesn't work, don't scale it, like this. And then beyond that, there was a lot of work kind of behind closed doors with government counterparts. When a government invests a large amount of money in a program, guess what? The message they want out there isn't that this didn't work. So this is part of a larger kind of World Bank operation. There is another component of this program that addresses women's livelihoods that had like wildly fantastic results from an impact evaluation. Guess which one of these programs got a huge headline in Zambia? That program, right? This one did not get like a roadshow to advertise like the wild success, because it wasn't, and no one wanted to advertise that we uncovered really high levels of violence and we don't exactly know what to do about it. And so it's not that this program hasn't gotten attention, it has, but it's closed door attention, right? We're now in consultation with the government about how do you kind of address this, what do you change? And so it's a very different road. And I think it's kind of, you have to keep pushing and stand strong with your conviction that like this doesn't work. And then there was a kind of more generalized question about scale up that I will address, even if it wasn't addressed towards me, which is this program in particular was designed to scale. So it was implemented by schools, teachers that are already in the system, and it was implemented in the context of a program that had the readily available capacity to scale nationally. And the government was ready to scale. And we really had to fight hard to say, don't scale this program, right? They're like, okay, we did the impact evaluation, we had the results, like, let's go. And we were like, please don't, like, please don't do that. And one of the conversations we had with them is when you're talking about scale, part of the reasons we do these pilots is to avoid a waste of resources, right? And we kind of, the ultimate argument we made to the government was, this is a very expensive way to not achieve your results, right? And that is what resonated. Like, let us help you figure out a better, less expensive way to do this. And so part of everyone wants to scale, and I think one of the important takeaways is sometimes don't do that. I'll stop there.
Fantastic. Let me thank again the panel. I think we're out of time, right? So thank you again. Round of applause.
Thank you all very much. I'm David Evans from the Center for Global Development, which is probably eminently obvious at this point in the workshop. Thanks for everybody who presented today. There's an old comic strip from The Far Side where there's a child in a classroom and he raises his hand and says, May I be excused? My brain is full, and that's about how I'm feeling right now. This has been a fabulous collection. I've seen a lot of work that I never would have encountered before. What we're going to do in this last session is just a couple of things. I think we have lunch coming very soon, and and hopefully there's some more conversations to be had before people part. I'm going to do a very brief kind of recap of what I saw, and then I would like to invite you. I'm going to ask you, we had a policy conversation last night. This has been a research workshop. I would love to hear from people in the room, based on what you've seen, what you see as kind of the sort of highest priority next steps in the research agenda in this space. And then we'll close out. So just in terms of a very brief recap of what I saw. Obviously, we saw a lot here today. I'm glad we started and ended with some efforts to combat, because there was a lot of rough stuff in the middle. We saw about sort of techniques to improve the measurement of school violence in Malawi. We saw evidence on the impact of school violence on mental health across more than a dozen countries, on self-esteem in Nigeria. We saw impacts this morning and yesterday on particularly vulnerable or understudied groups, children with disabilities in Sierra Leone, work in the fragile environment of Northwest Syria, the large minority of students witnessing or participating in drug-related violence in Eswatini, students being exposed to violence at home and then inflicting violence on teachers, with lots of teachers experiencing violence there in Cameroon, and we've seen this in other countries as well. And then this review showing that we tend to very much understudy kids in disadvantaged and underrepresented groups. Now, in terms of, we also saw just a little bit on societal views, right? So both conflicting views amongst children on corporal punishment and how that's evolving over time. Also how people on social media sort of engage and where they point blame and where they see the solutions are. And then last, we saw some solutions. I agree with what Karen said about how important it is to look at what hasn't worked. And so obviously we saw a little bit of that with this multi-component intervention in Zambia. We saw some more encouraging work with these school-based workshops, reducing violence and boosting exam scores in Peru. That comes back to the review that we saw yesterday that indicated how little we know about the impact of reducing violence on improving educational outcomes. I think we know pretty clearly that violence reduces educational outcomes, right? This is the next question. I think one of the things that was encouraging was that yesterday we saw a few examples, not just that example I mentioned in Peru, but also using parents as this entry point to increase empathy, boosting some academic outcomes in China, reducing gang recruiting in El Salvador, which reduced dropout. And as along with that, obviously some promising areas. We saw this work on libraries, new areas where we can look. Last night, my big takeaways from the policy panel we had yesterday afternoon: we need more evidence of interventions at scale. To be clear, interventions that work at scale, very important. We need more information on the interaction between interventions and policies, right? So it's one thing to train the teachers, it's another thing to make sure that if kids report violence, that something actually happens, something constructive happens. I thought the work that we saw last night on how long it took to get the Good Schools Toolkit right in Uganda, the amount of iteration that took, and when we think about what we're doing, work in other countries, the work we heard on making sure that we're open to different kinds of framing around this work. This is a school violence workshop, right? But framing it as safe schools, framing it as child safety, potentially bringing more donors, more funders, more operators in with that kind of framing. And then my last takeaway from the policy panel last night was that even though, we're all researchers here, we know we need to know a lot more, but we also need to be bold about helping governments and other implementers to boldly implement programs and learn as we go in that process and make sure that even as we figure this out, you know, Luis at the beginning of the session shared some startling statistics. Even as we figure this out, kids are safer and better off in school. And so never use this as an excuse to keep kids out of school for some reason, to think that we're helping them in that way, because we're not. I would love to just open this up now for a few minutes to hear about what you think are the high priority pieces of the agenda. I would love to hear from 1, 2, and 3, and then I'll take it for a second, and then I think we can squeeze in one more round. Thank you. So right here first.
Thank you so much. Amazing meeting. Thank you. I'm really glad to be here. I've learned so much from the intervention. It was super enriching. One of the things that struck me, though, is very little work has been presented to show what education systems were doing already to respond to violence. It's not like violence is new for them. Disciplinary measures, when someone gets knocked on their heads, there is a system in place already. Teachers lead with school violence every day. So it's education's everyday business. What is the baseline? And what is it that already exists at scale, huge scale, nationally, that we can build on and improve at a lower cost? Where is the low-hanging fruit? And I think in terms of research, maybe this is where we need to start. Because if we bring an externally driven approach, there is very little chance that it will be implemented at scale, because this is not the way education systems work. And I think we probably need to invite education authorities to teach us about how curricula is built, how plans are developed, how pre-service teacher training works, how regulations are developed, for us to work with that with other sectors, but education leaders need to be in the driving seat in the first place. So I don't agree with the fact that because it's a multi-sectoral issue, it falls within the cracks. If it happens in the education system, it needs to be led. The response needs to be led by education authorities. Thank you.
Thank you so much for such an engaging discussion. Very, very insightful presentation. I think I want to go back to what Karen said yesterday. I think we shouldn't be doing research just for the purposes of research. I think we should be taking a very concerted effort in terms of looking at what is being implemented, what is working, who is it working for, and why is it working or not working, you know? And so the research that we do should be in line with the interventions, the programs, the policies that are being implemented within different countries. I also think listening to all of these conversations, one of the things is I feel like we rarely address the structural determinants of health. And if there is anything that we have learned from these presentations, it is that poverty, food insecurity, gender, citizenship, disability, those are part and parcel of children's identities. And I think when in moving policy forward, we need to take that into account, you know. I also think that there has been, like, over the last, I want to say, 10 years, there has been a very concerted effort to look at those intersections between violence against women and violence against children. And I think based on what we are seeing here, we are seeing this overlap, the presentation today morning, the overlap of violence against teachers with violence against children as well. And we're seeing that like gang violence in the community is also coming in. And so looking at these different forms of violence and how they look at the intersection of mental health, sexual reproductive health, and those broader areas, which are an education achievement. And for adolescents and children, I think educational aspirations becomes like a very, very tangible like variable that we can look at when we are thinking or designing programs and looking. Yeah, so those are just some suggestions.
Thank you. Deepak.
Thank you. I wanted to make three related points. The first one being just to thank the organizer for putting together such a breadth of different and diverse views and interventions and putting them side by side, just so that we don't get used to thinking about just in our little boxes, that there is a whole diversity of approaches around addressing the issue of violence against children. The second point I wanted to make is this issue of understanding children's perspective of the issue, how they experience violence. That when you ask children, their understanding of what violence is very different from what adults think. Adults tend to think of violence as just an event, but children tend to think of it as a context of their experience and how they digest. And I think Jenny's presentation brought that out, that it's a multi-layered thing that is happening, and children are digesting what is happening to them through multi-layered experiences. And we need to bear that in mind in the interventions that we are developing and designing and testing out. And my final point, which is related to that, is that the quality of intervention is crucial, that evidence and good quality evidence depends on high quality interventions. And I think it's the linking of the two together that really matters. And so my suggestion to folks that are thinking about this is that it is really important that we don't think in silos, that research is one thing and intervention is another, but two go hand in hand. And in a meeting like this, we also need more people who are designing interventions, who have experience of how to tweak things so that they work better. I think they can add additional insights to some of the results and data that were presented here. Thank you.
Thank you. Let's go ahead to Sheila, and then Krista.
Hi, everyone. I'm Sheila with the Elevate Children Funders Group. Agree with so much of what has been shared. And really resonating with what you just shared, the last piece around not seen and thinking of research and programmatics as two separate entities. And as someone who works with funders, I'm really thinking about what's the message that we want to share. If you all you incredible researchers with the incredible research you've presented today, what is the key message to funders? And would be happy to continue to work on that and go down that journey with you all. I think one of the things that stuck with me is, and just Sophia presenting of what did not work, and speaking to, what was lacking was this accountability mechanism, the systems change, like what are the systemic things that need to shift and evolve, and making sure that things like that get highlighted and uplifted so funders are seeing and thinking about that. So thanks.
Thank you. Let's hear from Krista, and then Lupe, and then Ishani.
Hi, Krista Ridley.
I'll just encourage everybody, we're coming up against the time. I'm loving the ideas that I'm hearing, so I just encourage people to be efficient.
Great. Krista Ridley, former funder and practitioner, now with NIA Impact Strategies. One thing I've been thinking about a lot is norms, social and gender norms, and I know that came out in a lot of the presentations, and thank you for all the wonderful presentations, and thanks to the organizers. And how those impact punishment and how those impact violence against children. And one of the things that I had been thinking about for years is this nexus of the home, the school, and the community, where we have violence occurring in all of those places, yet we have very siloed interventions happening in those places. And so, as we heard, maybe the teacher wants to stop beating the child, but then the parent is saying, no, please do beat my child because that's the way they're going to learn. So how do you sort of break that mutual reinforcement of harmful norms? And so could there be research on that? I know that, you know, over time I've learned that to scale things, they need to be simple and you can't have all, you know, too many variables involved. But I wanted to think about how to sort of bring those things together in a research project. The second thing is on teacher training. I mean, that's, to me, seems like sort of a simple, direct thing that can be scaled when you incorporate issues around social norms and gender roles and other things into teacher training, positive discipline into teacher training. That can more easily be scaled than some other types of programs. And then finally, I had one more that now I lost. Learning outcomes. So I would like to see more research on that issue of how does reducing violence impact learning outcomes. I think we need that for sort of the continued advocacy with education funders. Thank you.
Thank you. Lupe?
Thank you so much for the amazing event. My comment resonates with what you just said. When we are working with governments, they want to know what to do. And when we say, oh, there is not enough evidence, first, many people say, yes, there is enough evidence because, of course, you know, it's very hard to differentiate what is causal versus no. So we are having a project with Gabriela in Tanzania where precisely they are saying, but what we should do, right? So a suggestion, you probably are already thinking of that on the messages from this discussion and this amazing workshop, like fine-tuning it to policy makers about what we know, what we don't know, and especially also what doesn't work. Because then we have like better, you know, an output that we can cite saying, you know, like this is what we know. You already have a few of those, and I really appreciate that. But like thinking of all of the things that have been discussed, and there are so many messages, thinking of policymakers and what we can use so that we move that part as well. Thank you.
So let's hear from Ishani and Danielle, and then we'll pause.
So I really like this comment about better understanding children's context and their experiences of the violence. And that got me thinking that I think, you know, we should be investing in long-term tracking studies to understand how violence experienced in the formative years can affect behavior and outcomes later in life. Sometimes this may look a little bit like research for the sake of research. You know, for a long time you may not find a whole lot of impact, but then maybe when that child becomes a parent themselves, that's when you start seeing that intergenerational cycle of violence persisting and creating a new set of traumas there. So I would just sort of encourage more long-term tracking.
Thanks. I'm Danielle. I'm from Social Development Direct and also the GBV Funders Forum. It's been super interesting and fascinating. I've really enjoyed the past couple of days. So thank you. For me, one of the things that I've been quizzing about, I guess, over the last couple of days is the response piece and the way in which I feel like almost it's separated out. And response, of course, can be a form of prevention. If we allow impunity to continue, then that is a norm, right? So I worked with Azat, who presented yesterday. We work on the safeguarding and gender equality piece of the Syria education program. And one of the things we did on purpose was we phased the work. So we put in place the policies, we put in place the reporting mechanisms, we worked with teachers, we trained, we supported, we worked with the education directorate to get that foundation in place, and now we're moving into the social norms so that the foundations and the safety was there to be able to make a difference. And I just wanted to comment on that, and as a foundation, I think yesterday it was mentioned like we don't know who the responsible person is, but the duty bearer, the foundation to human rights work in general, is that the duty bearer is always the government, and the duty bearer in this case is the Ministry of Education, and they have the power to put in place the policies, practices, and procedures in schools that we need to have as the foundation to then be able to do the GBV or the prevention work on top in a safe and ethical way. So I just wanted to highlight that.
Thank you very much. I think that's a fabulous point to end on. Like, without these systems in place, then there are, I think, real limits as to what else we could accomplish, while again, not using that as an excuse for inaction. I'm not going to recap all the ideas, but there are a lot of good ones. I wrote them down, so I know what I'm going to be doing for the next 5 years. I don't know about the best of you. We could keep having this conversation for a long time, but never get in between conference participants and their lunch. So if you'll indulge me for 60 more seconds, I just want to do a few thank yous. Thank you very much to Mahima and Ining and others on the education team who did a lot. The conference team, Shannon and Mike and Jeff and Jamie and John and others. I know it sounds like the characters of a sitcom, but they're all real. Especially grateful the volunteers on the, all the volunteers who helped make this run, who've been handling the mics over the course of the day. Our scientific committee, Jenny and Lelis and Sophia, fabulous. And then I'd like to ask for a round of applause for all of those, but especially for Gabriela Smarelli, who's the mastermind behind this whole thing. And who's doing a lot of excellent work. Also, just a very great thanks to everyone who came here and presented, everyone who came and participated. We have people here who traveled to come, even though you weren't presenting. We are very grateful. This has been an incredibly rich conversation. I've learned a great deal, and I've been thinking about this topic for a little while. And one of my greatest hopes is that coming away from this, that we can nurture these connections and make sure that the research that we're doing adds up to good policy, good practice, and good action. Thank you very much.